Sinya uli di sombranzelten mak et zu ita saluda antes di nigap Radzaudzan malakes fredzas durante todo imemu a nogi distancia gumugupugi palu zangiman malak guafi con una sughiairi preba tu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa giluk tanu man libri sentami ti man ko badi
Quando You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
Take me soon, 'cause I am here for a reason. Sometimes in my tears I drown, but I never let it get me down. So when negativity surrounds, I know someday it'll all turn around, because all my life I've been waiting for, I've been praying for the people to say that we don't want to fight no more. There'll be no more wars, and our children will play one day, one day, one day, one day, one day, one day. It's not about win or lose, 'cause we all lose when they feed on the souls of the innocent. Blood-drenched pavement, keep on moving though the waters stay raging. In this maze you can't lose your way, your way. It might drive you crazy, but don't let it phase you, no way, no way. Sometimes in my tears I drown, but I never let it get me down. So when negativity surrounds, I know someday it'll all turn around, because all my life I've been waiting for, I've been praying for the people to say that we don't want to fight no more. There'll be no more wars, and our children will play one day, one day, one day, one day, one day, one day. One day this all will change, treat people the same. Stop with the violence, down with the hate. One day we'll all be free and proud to be under the same sun, singing songs of freedom like whoa, 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 whoa. All my life I've been waiting for, I've been praying for the people to say that we don't want to fight no more. There'll be no more wars, and our children will play one day, one day, one day, one day, one day, one day.
Good morning, Sabrina.
Good morning.
Good morning, Harmon.
Good morning, Agate.
Good morning, Sumai.
Good morning, Umatic.
Good morning, Las Vegas.
Good morning, Family Beach.
Good morning, Las Palmas.
There you go.
Good morning, San Diego.
Good morning, Ironwood Estates.
Good morning, Agafa Gumes.
There you go.
Good morning, Oklahoma.
Good morning,
Good
Smurftown.
morning. We want to say shout out to Gura 501, 502, 503, 508. All the people in Gura. Good morning.
Good morning, Guras 501 through 8.
Good morning, Texas.
Good morning, Pequot. Good morning, Malesa. Good morning, Inalahan. Good morning, Malolo. Talafofo. Good morning, Ipan.
Good morning, Missouri or Missouri? I think if you're from there, you say Missouri.
Yeah. Good morning, Mangilo. Good morning, Monkey Town.
What did the mayor, Alan Ngaka, call Manila the other day when we had him on it? The education capital
Right,
of Guam. What, you got UOG, GCC,
Right.
FD, GW.
The Japanese school.
That's right.
Dude, the IQ in Mangilo is like 5,000
Dude, for real.
on a school day.
Oh, good morning, Ladera Tower. Speaking of Manila.
Good morning, DOC.
Good morning, Sleepy Lagoon.
Good morning, Afami Sinanya. Good morning, Sin City. Good morning, Agania. Good morning, MTM. Good morning, Asen.
Across the street, good morning, Agania Heights. Best view of the island at Fort Apugan when the sun comes up. Oh, unmistakable.
Good morning, Fort Lee, Virginia.
Oh, nice.
Jay, actually, the sun rises on the other side.
No. Well,
Good morning to Mooning.
I always shoot in panoramic mode, so I'm turning around.
Good morning, Fountain Valley, California.
Good morning, Bardstown, Kentucky.
Good morning, Coral Gables, Florida. That's South Florida.
Good morning, Luta.
Good morning to
There you
Deanne.
go.
Oh, wow. Good morning from Teedson High School.
All right, home of the Titans.
Good morning, Edinburgh, Texas, and everybody down there. Corpus Christi.
Good morning, Managaha. And also, good morning. Good morning, eh? To our-
Good morning.
to our
Good morning
viewers
to our
in,
friends in the Philippines. That's a Joe Sir special.
Right, we also have our friends in Canada, Barragata, who are watching. Hey, good morning. It's 6:17. This is the link on the breeze, 93.9. Sabrina Salas, Matanani, of course. Jason Salas. We got Joe Sir, Ken Engineer, the guys of Master Control. Good morning to our viewers on KUAM TV 11. And our watchers on, of course, our KUAM News Facebook Live page. Good morning to you guys. Good morning from Fairfield, California. Deriro also checking in. And Cebu, Philippines. Joe Sir.
Hey, good morning to Whisper. Who's watching?
Good morning, Whisper. Hey, it's the link of the breeze, 93.9 KUAM FM in Hagåtña, Guam. It's all proudly brought to you by First Hawaiian Bank, IT&E, and Calvo Enterprises. A big show this morning, Bree.
Yeah?
Yeah, I think so. Yeah, I hope so. We got Dr. Felix Cabrera from the Physicians Advisory Group. We're also going to continue our Network of Nurses segment. That's something we do with the Guam Nurses Association.
Well, yep, we do. That's thanks to Susan. So,
Yep, we do.
and you did the interview yesterday. I think
Yeah.
it was a good interview.
It was pretty cool. It's going to be it's neat. It's coming up at 6:45, and all the nurses, they all tune in at that time because they want to watch this segment. I know a bunch of doctors are going to be watching. Good morning, Jigo in the House of All Ears, and good morning to BMS, home of the Roadrunners. Santa Rita also checking in the house, and then we got Daphne Shimizu of the Rev Tax Department. She's the director, of course. She'll be coming on to give us an update. A guy's been calling about the tax refunds the last 3 days. So we'll definitely ask. Also, good morning to Winnie Jenny from Vancouver, Washington. We'll ask DAFA what's the status on the payout of the tax returns and how current we are. And then, Bree, we've been doing this suicide awareness thing because it is Suicide Awareness and Prevention Month. And it's also Recovery Month.
Right. So we've got Jesse Manjola,
Right.
who is coming on. He is a recovered addict, and he's going to share his story and just be an inspiration to people out there who may be trying to find their way these days. So we're so grateful that he's coming on. I know I interviewed him, I think, about a year ago,
Right.
when he shared his story when we were doing our show starting lineup. So it's going to be nice to check back in with him.
Yeah, and then we're also going to get Athena Duenas from the Guam Behavioral Health and Wellness Center. She's the lead on the drug and alcohol program. We've got Jeremiah Santos, who's a peer recovery specialist with the Lighthouse Recovery Center. Val Regis, who's the director of LRC, and Chris Francisco, who's a clinical supervisor of LRC. So, guys, we all know drug addiction, big problem on Guam, and it didn't, COVID, it's not one of those things that COVID canceled. In a lot of ways, it's gotten worse. So we'll break bread this morning with people on the recovery front lines because it's important. Also, we're going to get Dr. Kenny Bourgeois on. You shall never know all the good and simple stuff.
There you go.
Right, something like that. Yeah, so Dr. Kenny reached out to me a couple days ago when we had environmental health on about this, Bree, is it Calvary or Calgary?
Calvary.
Calvary Chapel. And so they'd issued a citation, and they came on, they gave their side, and I got a bunch of messages from people who go to church there. And Dr. Kenny was one of them, and he was like, hey, that's not how it happened, da-da-da-da. So I ended up calling him to touch base yesterday, and he had some pretty interesting thoughts about the Department of Defense and the things they could do to kind of help the island out. And I was like, man, I like what you're saying. Let's get you on. And so what did he say? He's a counter voice. So I don't know exactly what that means.
Voices are welcome.
Hey, there you
Well,
go.
that is the interesting thing because everybody knows Dr. Bourgeois as the dentist du jour on Guam, right?
Right.
But in his previous career, he was in the Navy, and I believe he was an infection control specialist.
Yeah.
And then he's also a pastor, for his own church. So he definitely has the pulse of the faithful.
Right, and so we'll talk with him this morning, and then over at Gain, P-Core 1, their operations, Cyrus Lure. I know Gain. What? We're going to show you pictures of puppies and kittens.
Oh.
If anything, okay. If anything, this morning you're getting puppies and kitty cats. All right, on our multimedia broadcast, it's 6:21. Good morning on you. It's the Link of the Breeze 93.9. We'll go ahead and start with our link update.
I'll start it.
Are
I'll
you
start
starting?
it. Yeah, I'll start it.
Okay. Sabrina Salas-Manzanani with the latest news from the KUAM News team. Good morning, Sabrina.
Hafaday, good morning, everyone. The island has recorded another death on Wednesday connected to the coronavirus, according to the Joint Information Center. She was a 60-year-old woman with comorbidities. She was admitted to the Guam Memorial Hospital on August 27th after testing positive at Guam Regional Medical City on that same day. The patient passed away at around 12 noon yesterday. Governor Lulian Guro says this virus is taken too much too soon. All of us need to do what we can to protect our loved ones and our entire island community. Do what we know works. Stay home. Wear your masks and wash your hands. That is how we can end this fight. This marks Guam's 20th COVID-connected fatality. Meanwhile, there were 45 positive results reported last night by the Joint Information Center. That is out of 683 samples ran at various labs. Guam's COVID case count is now 1,758 confirmed cases, 696 active cases, and 1,042 recoveries. Over at the Department of Education, there were 7 more positive cases identified, 2 at GDOE Teads offices, 1 from Tamuning Elementary, and 4 from FB Leon Guerrero Middle School in Jigo. All 7 were identified through contact tracing. Hospitalizations at the Guam Memorial Hospital continue to climb. Hospital Administrator Lillian Posadas tells KUAM the latest numbers, this is as of Wednesday, 53 COVID-19 patients admitted to GMH. 13 of those patients are receiving ICU level of care. 11 of those 13 patients are on ventilators. Posada says that GMH stopped accepting non-COVID ICU patients as the island's only public hospital continues to struggle with capacity issues. And here now is more news. More news now here on The Link. In spite of the rising number of deaths related to COVID, there are hundreds of people that have recovered from the virus. Tyler Mazzanani reports.
Among the countless COVID recovery cases is 33-year-old Wilhelmina Dios Duenas. She tested positive for the coronavirus about 1 month ago and spent 2 weeks at the government's isolation facility at Days Inn.
They checked on you 3 times a day. They take your temperature and your heart rate and your oxygen level in the morning when they deliver breakfast. Then they also check it in the evening when they deliver dinner. And then like midday, they give you a phone call. One of the nurses at the nurses station will call you and they'll go over like the checklist of symptoms and they'll ask you, are you experiencing any of these? The only symptom on that checklist that I remember experiencing was just the loss of smell. Which lasted throughout my entire stay.
According to Duenas, she experienced a few headaches, was nauseous, but never had a fever and never lost her sense of taste. Fortunately, she says she had a mild case and even found humor in the ordeal.
Shortness of breath I'm fat, so that's normal.
And while she jokes about it, Duenas acknowledges the severity of the situation, because not only was she infected, but other members of her family in the same house. Like her, thankfully, all of them recovered from COVID. At the end of the day, she is urging everyone to follow the governor's stay-at-home orders and in your own unique way, stay safe and entertained.
For that first isolation, I bought like one of those little blow-up swimming pools and I like hung out in the swimming pool, like was Skyping with all my friends and like house party and all that stuff. So it's possible, and I understand how crazy everybody's going at home.
Just because we're in P-Core 1 for Wilhelmina, it doesn't mean it can't be P-Core fun, but at home. Reporting for Guam's News Network, I'm Tyler Mazzanani.
As Guam Supply Lifeline, the Port Authority is doing as much as it can to remain operational throughout the COVID pandemic. So far, 6 port employees and 5 customs inspectors assigned to the port have been infected. General Manager Roy Respicio.
We are doing everything we can to assist public health in the contact tracing, and the protocols provide that as soon as we have a confirmed positive, we automatically reach out to the employee. For those who have been confirmed positive, we reach out to them daily. We check on their status, and just to make sure that we do whatever we can to help.
The port has set up its own internal contact tracing team, and several employees, including Respicio, are certified contact tracers under CDC guidelines. They've tested nearly 300 close contacts, and 3 of the infected employees have since returned to work.
When we started seeing the potentiality of having a port member exposed, either ourselves or through a family member, I reached out right away to Governor Leon Guerrero, who then instructed that the port clinic be stand up. And since then, we have about almost 24,000 port visits.
He says there are a variety of preventative measures that have been implemented, such as taking the temperature of all those entering the port, setting up hand washing stations, and daily deep cleaning, all designed to keep the port running.
So the whole goal here is, with the CDC guidelines for critical infrastructure worker, is to ensure that the supply chain is not interrupted or disrupted, but at the same time protect the health and safety of all the employees.
For Guam's News Network, I'm Nestor Lecanto.
For more news, stay connected to the link. $22 million in additional unemployment assistance for Guam has been approved by FEMA. The Guam Department of Labor says under the Trump administration's Lost Wages Assistance Program, about 25,000 qualified applicants will receive an added $400 a week for 3 weeks. The military confirms that hundreds of participants will be taking part in the Valiant Shield exercise. Those arriving on island will be staying in hotels for the duration of the exercise. Prior to their arrival, service members spent more than 14 days in quarantine and tested negative for COVID-19. They will only be permitted to travel from their hotel to their appointed place of military duty on base. According to Joint Region Marianas Public Affairs Officer Lieutenant Commander Rick Moore, this restriction will be strictly enforced and is for the health and safety of both the local community as well as the service members involved. With regional headlines, here is KSPN2 News.
Hafa Guam, here are the headlines for CNMI.
Maria Terlahi says she wants to help save the earth. Early this morning, she headed to the Civic Beach Park to do a little labor of love.
I advocate love and respect, especially for our environment. A lot of things that I do is push for the goals of the Micronesia Challenge, which is to preserve and conserve 30% of our marine resources, 30% of our marine resources, and 20% of our terrestrial. So on this beach, we can see that we have trash from land to our seas, and we want to promote that goal by cleaning our beaches.
Ria was joined by family members, friends, and people of the community who share the same concern for the environment.
I created a flyer and it was open to the public, but I have so much support from my friends and family that are here. A lot of people here I've never met before, so I'm so grateful to meet new people and that want to make a difference.
The cleanup at Susupi was organized with the help of Ria's mom, who is very happy with the turnout.
I believe they tried to do all the way from the Susupi Beach Park, and they wanted to go as far down all the way to the end where the intersection is in front of Micro Toyota. And so, of course, we told them, if you're tired, come back. But if you can keep going, and we'll pick up the trash wherever you guys finish up so you don't have to carry it all the way back. And so it's been a great turnout. We've got a good, I want to say more than 100 people showed up today, which was beyond our expectation. My daughter has planned this throughout the week, and just through social media, and friends passing word of mouth, we've got a great turnout, great support for the cause, great support for Maria.
Maria is also a contestant in the 2020 Miss Earth Northern Marianas pageant.
I'm running for Miss Earth to inspire through education. I truly believe that inspiration will awaken new possibilities and change standard habits like single-use plastic, and also push to motivate a drive to be educated.
Reporting for KSPN News, I'm Sally Lemis.
For more news, visit saipantv.com. For KSPN2, I'm Ashley McDowell.
Thanks, Ashley. In national news, former Vice President Joe Biden will unveil a new manufacturing proposal designed to get jobs back in America. While jobs and the economy remain one of the most important issues for many voters, the candidates also continue to debate a timeline for a coronavirus vaccine. Skylar Henry has more details from the White House.
Democratic presidential nominee Joe Biden is in Michigan today, promising to bring jobs back to America.
This president is on track to be the only president in modern history to end up with fewer jobs at the end of his term than existed in America when he began his term.
His new manufacturing proposal includes a 10% Made in America tax credit for companies that bring overseas jobs back to the U.S. or increase domestic production.
We're going to make sure that any time American government spends American tax dollars, we're going to spend them in America with American companies and suppliers supporting American workers.
But President Trump says he's the champion of American workers, not Biden.
Joe Biden's agenda is made in China. My agenda is made in the USA.
President Trump says the economy was going strong until the pandemic hit, and he blames Democratic governors for keeping some states closed.
On November 4th, every one of those states will be open. They're doing it for political reasons. No, they're doing it for political reasons.
The president also says Democrats don't want to see a coronavirus vaccine.
The Biden-Harris effort to spread anti-vaccine conspiracy theories only because they know we are close to putting it out, getting it out, and we're going to get it out fast.
If I could get a vaccine tomorrow, I'd do it. If it cost me the election, I'd do it. We need a vaccine, and we need it now.
While AstraZeneca has put its vaccine trial on hold, Pfizer announced it may be ready for regulatory review as early as next month. Skylar Henry, CBS News, the White House.
The Guam Memorial Hospital back to accepting Take Care members effective Wednesday. The company announced it has reached an agreement with GMH to allow a third-party independent auditor, Ernst & Young, paid for by Take Care, to reconcile $17.4 million in claims and a $6.3 million payment that are in dispute. The health insurance company says it made a $1.7 million good faith payment, and GMH agreed to accept its members again. Take Care further said if the audit shows it owes any money, it will pay up within 2 weeks. The billing dispute dates back several years. The hospital previously accepted Take Care members, but as self-pay patients. The U.S. Department of Education has notified GDOE that it will have the opportunity to begin transitioning away from the oversight of a third-party fiduciary agent. It was in 2003 the feds designated GDOE as a high-risk grantee for failing to properly account for how federal monies were being spent. Over the last several years, GDOE has been spending at least $2.5 million annually for a third party. Following a virtual monitoring visit in July, the feds acknowledged the notable progress GDOE has made. The local education department has until the 31st of January to demonstrate sustained improvements and assume the responsibilities of the third-party fiduciary agent. And that's your news for now, but we're going to head into our Zoom room where the Department of Labor Director David Delasola joins us live. Good morning, Dave.
Good morning, Chris. Good morning, Sabrina. How you guys doing?
We're doing pretty good. Thanks for joining us. I don't even want to say last minute, more like last second, to give us that update. So we'll just go ahead and give you the floor. What does that mean? The FEMA has approved an extension on the unemployment. So
what it means is I talked about this a while ago. This is the Trump package, the lost wage assistance program. We applied for it last week, and it came back with some questions, and sat down with the governor, went through all the risks and the pros and the cons, and she agreed that we need to get the money out to the people. So we cleaned it all up, and then they approved us last night, for $22.5 million. And this will, for our initial budget, was for 3 weeks for claims that were filed after the FPUC expired. So this was for the 27th of July through the 15th of August. And they will see, I think they're working on language now to allow us to keep expending that for maybe 5 to 6 weeks if we don't spend the whole $22.5 million. So they're still working out all the details and the information. I think all we have to do is keep asking for approval for the additional weeks. But yes, we have 22.5 million additional dollars going to be going out to our claimants as soon as the money gets loaded, and we managed to figure out how to program it into our PUA software system.
And this isn't something that people have to apply for, right? Or
no.
Okay.
Basically, that's why we're going to try to work it into our software system. The big difference between the FPUC and this is that any of the weeks that the claimant files for after July 27th, they have to make at least $100 a PUA to qualify for this additional $300 to $400.
Okay.
Dave, can you just give us a quick update on the status of the PUA payouts?
Yeah, well, we just released another batch Tuesday, and that is running as we speak. That was about 26 million. So I'm hoping to get that out to the banks, and if everything gets drawn down and works out because of the holiday, it might get delayed a little bit. But early next week, that should hit the banks. And we continue during PCOR 1. My PUA staff continue to work hard to clean the claims, to fix claims, and to take claims, and to pay claims. So we're really working hard during this time and to try to keep the money flowing to the people that are out of work. And we appreciate their patience because we know that it's tough to get through the phone lines. You know, we reduced in staff because we were reducing in as the main hit of the claims, and then all of a sudden another PCOR 1 hit us. So we're doing the best that we can, and they're all working very hard. And then of course we're in the middle of all this. We're also applying for this additional $22.6 million, and I'm happy to say that we got that, and that'll be added in, and we'll just keep continuing chasing the money.
Did you guys ever get that 250? I think it was. You said $1,000. You were hoping to get from the feds when we talked with you last week.
That is still awaiting, but that's pretty much going to be a done deal. From my understanding, it's just over 226. There's so many numbers flying around. $1,000, and that's basically to assist us with overpayments and fraud. Fraud continues to be a major problem with us. We probably estimate that we've had over 20,000 fraudulent claims that we've managed to identify. And like I said before, as time goes on, they just keep zeroing in and making it tougher and tougher to identify them. And that's the only thing about this presidential, the Trump LWA program, is that the state and territories that participate are liable to pay back any fraud or overpayments. So that's something that may delay us getting the money out, because I'm going to have to do some really extra scrubbing on those claims to ensure that the liability for Guam is minimized.
And I was going to say, when we spoke with Edward Byrne earlier, he was talking about how he has to turn in this detailed expenditure report to the U.S. Treasury to explain and show where they spent the CARES Act funding. Are you guys having to do the same in terms of providing some sort of reports to the feds on PUA and FPUC?
We basically give your general reports about how the money that we've drawn down, and then how they were paid out, broken out into checks, and how many direct deposits and things like that. We haven't been, not till the program probably stops, that you're going to really have to circle back and get into the nitty gritty as far as how much is overpayments, how much, the fraud is something that, we're not paying it. We're just identifying it, and we're DQing it, and then moving on. So, the fine details are stuff that we haven't gotten into yet, is because we're just, in most states, are just trying to get the money out and trying to keep the money flowing. And we are, balancing the monies, meaning, we let out, we put out about $350 million out, and we just have to balance that with the money that we've drawn down, with how many checks. It's still a big juggling act, because we have to, it's the return the return deposits. We get 100 to 200 return deposits for wrong information, and that has to be reconciled. We get checks that are sent out that get returned because of bad addresses. We have people that, all that accounting has to be balanced out. And before we ask for an additional allotment, those numbers have to be fairly close and balanced before they will give us another drawdown.
In terms of the overpayments, have you guys already started calling people regarding the overpayments and telling them, hey, you need to pay back that money? I know you were talking about
Yes.
how the $220,000 you were getting that
Yeah.
to help to recoup that money, but have you already started?
Yes. We do have a small team of people that are currently got all the forms together and the processes. It's still with USDOL, the whole, as far as overpayment and the appeals process, but we're not waiting. We're moving forward on those. And so those are just ramping out. Letters are just starting to go out so that we can test the system and the process, especially to those people that maybe got paid and they know that they didn't, they want to pay it back. So we want to get that money back before they, spend it. And so we're working on getting those started. The appeals process is also, the forms are starting to get ready to get sent out. So all that is being ramped up as we speak, and hopefully next week we'll start actually moving forward with both those two divisions.
David, I talked to a friend who had told me, and really rather just unfortunate set of circumstances where elderly man was approved for the unemployment assistance, and then the beginning of this month was advised he had to pay back $6,000. But the guy is, obviously still unemployed, ill, and the family's saying, we don't know what to do. The money's not, it's gone. He was told he's approved, and he didn't get the denial until, a couple months after he had already been approved. So are we seeing a lot of situations like that where people got the unemployment, and again, maybe the intent to defraud the system wasn't there for whatever reason? These claims end up getting denied, and you're looking at people already hard up having to pay back thousands of dollars. And what would the timeline be on that?
It's not like frequent, but we do have circumstances like that, and that's what happens when you're trying to get money out as quickly as possible. And if you ever filled out those forms, you self-certify a lot. You put in the forms, and if you answer correct questions incorrectly, whether fraudulent or unfraudulently, there is a way that you can get approved.
Right.
It's not super difficult to do that. If most of your stuff is true and you just are fudging maybe the date that you were laid affected, or that a lot of people, in those kind of circumstances were incorrect, that they weren't laid off because of COVID. Maybe they were fired.
Yeah.
Maybe they were unemployed and they still managed to get the system to approve them. You know, people have to remember this is a system that was given to me, that was written for PUA and approved by USDOL. I'm doing a program that's doing that. I don't have any judgment calls. You know, everything that gets paid out has to follow the set of rules, that they have to be laid off, reduced in hours because of COVID, and they can't be for any other reason. And a lot of people feel that they deserve the money because they're not working, and they go in and they approve it and they can get the money. I don't have any judgment calls to say, yeah, I can give it to you because your circumstances are you know, warrant it or not. I have to follow the rules, and it's pretty clean cut. And unfortunately, there are people that get paid that aren't supposed to be getting paid because the information was either incorrectly inputted into the system, or you know, and it falsely judged them as being qualified.
Dave, last comment here. Number. Can we just get the numbers again for people who have additional questions?
The best number to dial is the 311 option 6. I am saying that, you know, we are working. Some are working at home. Some are at our call center. Because of the PCOR 1, we've had to spread them out farther away, and are trying to do our best to practice safe distancing. We've had some issues of contact tracing with some of the employees, and we've lost a few for temporary quarantining. So this whole COVID has affected our operations also, but we knock on wood, and everybody is healthy and is well, and we're just keep continuing to do our best with the numbers that we have going.
Thanks for jumping on so quick, Dave. Appreciate it.
Thank you.
Thank you guys for having me. You guys stay safe and wash your hands.
You too. Okay, digging the butt bus there, Dave. He's got the PCOR 1 facial hair going on. It's 6:48. We're going to take a quick break and come back with our Network of Nurses segment that we do with the Guam Nurses Association. That's next on The Link. It's The Breeze 93.9.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Hafa-day. My name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers for Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
Hafa-day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Good morning. It's the Link of the Breeze, 93.9 at 6:52, Thursday, September 10th. We do have some breaking news from the KUAM news team. Sabrina Salas Mantanani. Good morning, Sabrina.
Guam has recorded another COVID-connected death. This marks the 21st COVID-19 related fatality. It occurred at the Guam Memorial Hospital early this morning at approximately 12:07 a.m. According to the Joint Information Center, she was a 74-year-old woman with comorbidities that were compounded by COVID-19. She was admitted to GMH on August 25th. Again, Guam has recorded its 21st COVID-19 related fatality. The governor saying, quote, "It seems we will not get rest from our days of sadness. This morning we lost another soul to COVID-19. No words can heal the pain from such a loss, but Jeff, Lieutenant Governor Josh, and I send our condolences and sympathies to everyone she loved. To the people of Guam, we must do all we can to keep each other safe." Again, she was a 74-year-old woman with comorbidities that were compounded by COVID-19. She was admitted to the Guam Memorial Hospital on August 25th.
Uh, 6:54. So our thoughts and prayers, man, going out. It's just been rough since Friday. We've seen the spike in deaths. We had the doctors on yesterday. Dr. Jana McLaughlin had thrown out a stat, I believe it was her or Hoa, Dr. Hoa, about the chances of survival when you have COVID-19 and you're on a ventilator. And so right off the bat, we started the show yesterday. They said, oh, if we have 13 people on the ventilators, we're anticipating 4 to 5 of them won't make it. And I'm serious, guys. 6:55. Let's go ahead and play this. We got Dr. Felix Cabrera from the Physicians Advisory Group coming up in a few minutes, and hopefully he'll be able to shed a little more light as this death was just announced, a matter of minutes ago. And you heard it here on the link. So let's get into our network of nurses segment, Bree.
Yes, this is in partnership with the Guam Nurses Association. I want to thank Suzanne Louboutin. I reached out to her, and she just jumped right on it.
Right.
And set us up with a whole network of nurses on Guam, our frontliners, and we're extremely appreciative for all that they do in our community.
And so I got to interview Paula Manzon, a nurse over at the Guam Memorial Hospital, for this week's episode of Network of Nurses. Off a day, and welcome to our partnership with the Guam Nurses Association. This is our network of nurses, and we have Hafa Day, and welcome to our partnership with the Guam Nurses Association. This is our network of nurses, and we have today Paula Manzon of the Guam Memorial Hospital. Hafa Day, Paula.
Hafa Day, Chris.
In talking before this interview, you have a really interesting job, and if you could just share with us, just give us your title and again, layman's terms, right? Because we're not doctors. Just describe the work you do at the hospital, and then we'll kind of get into what we discussed specifically about COVID.
So I'm the clinical nurse informatics supervisor here at Guam Memorial Hospital. That particular position is fairly new here on the island. I'm also a registered nurse, and I'm certified in nursing informatics. So that's my title here. It's basically a nurse that's connected with the IT department, but also has a background on nursing per se. So I bring those two worlds together, and then we play a critical role in patient care by providing all of the technologies needed for all of our clinicians on the floor. That's basically what nursing informatics is.
Right, and so when we talked about this, you're responsible for the electronic health records, and you make sure that the right information from the right patients goes into this so that the doctors can make the right call when providing acute, critical, and traditional care at the hospital, right?
That's absolutely right. And it's just not me, but there's a whole team from IT and then the clinical side as well. And the ancillary side, all of our respiratory therapists, all of these people contribute to this one project that we have currently for the electronic health record.
Right, and so that's where your nursing background comes in, because you're just not inputting data, right? You have to have that understanding of what the data and that information means to patients and doctors.
Yes, definitely. So I've worked on the floor for about 4 years. I'm a graduate of the University of Guam. So basically, if we needed an equipment or a technology equipment on the floor, you need to understand how to use it. And as a nurse, I would say, oh, that doesn't work that way. This is how the nurse would use that particular machine per se, yeah.
And so we talked about what your duties have kind of shifted to recently with the onset of the coronavirus pandemic. And I thought it was really interesting because in a lot of ways, well, I guess not even in a lot of ways, but you are connecting patients who are fighting COVID-19 who aren't able to see their family members because of how contagious and insidious this virus is. You're connecting them with those family members through the use of technology.
Yep. So in the first wave, we were actually seeking out to purchase tablets. And you know what? There's so many people in this community are so giving. Businesses on all sides, IT&E, GTA, am I forgetting something? Docomo have all given us tablets to use. And then on the second wave, even more so now, we have more patients in the hospital. So we placed iPads inside of each and every room. And then we connected one to the iPad in the nurse's station. So whenever we needed to call the patient or the patient needed to call the nurse's station, they can have video conferencing, and that reduces exposure for our staff needing to go in there for just one thing or multiple things.
Right.
And also we plan to do things like stream masses, because it's really, when I was setting up those iPads in those rooms, it's really, really isolating, and it's very sad. But we wanted to make sure we can do that for each of the patients, and it's really helped out. Even with clinician to clinician, we're using Zoom now via tablet, so we can communicate better as a team. Our management is using Zoom and those capabilities as well.
Was this an idea that was prompted by maybe something you guys might have seen nationwide?
Yes, of course. As an informatics nurse, we always have to research and be on the cutting edge of things. We want to look into that, especially here on Guam. We feel so very isolated from everybody else, but the research on that particular thing is that
these technologies can help. Though we don't want to take away the human interaction completely, because that's how nurses are. We care for our patients and we want to be right near them. But in this very case, we looked at other hospitals and what they're doing in regards to technology. So that's what we came up with. Not only that, telemedicine is a big thing. It's one of our big projects here. Right. Having to do telemed from here to Guam Behavioral Health, so we don't have to transfer our patients there. It's such an efficient way to be able to give our patients access to different things.
And when you talk about being able to stream masses and allowing these COVID-19 cases to maybe talk with their families through Zoom, a platform like this, is that what's happening with these devices at GMH?
Yeah, so we have several platforms that we use, not only for telemedicine and for patient care. So we have Zoom Healthcare. That's what we use to communicate with them. Pretty secure. We have security controls on all of the devices that we have. Yeah.
Let's talk about the isolation that comes with COVID-19, right? So again, highly contagious. It finds a way to transmit itself from person to person. We've seen that, at the hospital. I mean, not just with the patients who come in positive, but with the staff. So how important is technology in bringing some comfort and some company to these patients who, can't get visitors, can't, hear from, not just their family members, sometimes even their kids?
Yeah, it's definitely a struggle to learn technology. Not everybody uses Zoom, but we work hard to walk them through it, and it's very comforting, I think, just to see somebody, just to talk to one person, even if it's the nurse at the nurse's station, just saying hi every day. I think it would bring them significant comfort, and it's just very, there's nobody else there in the room, so it's nice to just give them that service.
When my grandfather was in the hospital at GMH, one of the parts of the day that he really looked forward to was those times when the nurses go and check on the patients. So I can really relate to how happy these patients must be even if they're Zooming a nurse right from down the hall. Can you describe that feeling, that maybe that satisfaction you get in the midst of this crazy pandemic that's, taking so many lives? What's it like to put a smile on somebody's face because of the work that you do? They can talk to their parents, they can talk to their kids, their family members, they can talk to the nurse.
It's very heartwarming to see that your work is being used for that purpose. I don't do bedside care anymore, and I'm more in the administrative roles now, but being able to do that for patients still is very heartwarming to me. Actually, my grandmother is in the PI. She's intubated. She has COVID-19, and on the receiving end, on the other end, it's very comforting to know that you can still do that and see them, because completely you can't visit anybody there. My family there can't even visit her. So being able to have that is very important.
That's such an interesting personal insight to know that. You're a frontliner doing important work behind the scenes, and you're right there with these patients that you're trying to help. And that, our thoughts and prayers are with you and your grandma, first of all. And when we talk about, when we talked before this interview, you being a key player behind the scenes, right? That means that you've got, team members who are out there with the patients. Let's talk about that cohesiveness of that GMH family of the nurses working together with you.
Yep. So nurses and physicians, I've never seen, not never seen, but it's so heartwarming to see everybody work together to be able to provide service every day for our patients here, especially the COVID patients, because we're all worried, and we're all scared, but we try not to show show that to everybody because we had to put up that strong front. And teamwork has been amazing here, not only on the clinical lines, the administrative lines. I mean, the leadership is, I've never seen us work so hard together as a group every day. So I'm very, very proud to be part of this team here at GMH and being able to take care of these patients every day. Yep.
I want to thank you for taking a little break to talk with us. I know you're working hard, so we're going to let you get back to working. Just really thank you for sharing your story with us. You got me there with Grandma. Our thoughts and prayers are with her and with you and with everybody at the hospital, from the patients to the doctors to the nurses and our network of nurses. So thank you very much.
Thank you so much, Chris. And thank you, KUM and Suzanne Lobaton. Thank you.
You know, this is, again, Network of Nurses. It's in partnership with the Guam Nurses Association. It's a segment that we're doing here on the link every Thursday. The Guam Nurses Association, it was incorporated in 1951 and has been a constituent member of the American Nurses Association since 1968. It's a nonprofit organization made out of 172 members, including a set of elected and volunteer officers. So again, thank you to the Guam Nurses Association for providing these network of nurses and giving us this opportunity to highlight what they're doing for all of us here.
Yeah, there's a comment here from Melanie. Being alone causes a great decline in health, and that's why I think the use of the technology in this situation where we know you can't go visit people who are COVID positive, it's so key. So thank you, Paula. And all of our nurses. 7:07, we'll take a short break. Remember, breaking news, the island has recorded its 21st COVID-related fatality. We got the notice just minutes ago.
Yep, she was a 74-year-old woman with comorbidities that were compounded by COVID-19. She was admitted to GMH on August 25th, and she passed away at 12:07. This morning.
It's 7:07. This is the Link on the Breeze 93.9. Coming back with Dr. Felix Cabrera of the Physicians Advisory Group next. Good morning.
We're celebrating your special date.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday, my name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers for Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
Good morning. Island Woman, Myung. I think he's out staying out in San Diego with the wife now. 712, good morning. It's the Link of the Breeze, 93.9. Let's just jump right into our KUAM News Zoom room where we have standing by Dr. Felix Cabrera of the Physicians Advisory Group. Good morning, Doc.
Good morning, Chris. Good morning, Bree. Good morning, Jason.
Good morning.
So we know we have the meeting tonight, but if we could just, and I don't know if you have any additional information on the 21st COVID-related fatality, but if you do, is there anything you can tell us, Doc?
No, I don't have any further information than what was just released, but, deepest condolences to the family and friends and to all those that we've lost so far to COVID-related deaths.
What do you make of this increase since Friday? I mean, the deaths have, and this is something that the docs on the PAG had warned us about. They said, hey, when we went to this PCOR 1 lockdown, hospitalizations are going to rise. They continue to rise. GMH no longer accepting non-COVID ICU patients, and the deaths are so tragic. They just keep coming.
Yeah, and unfortunately, they're going to continue to keep coming, so I think, none of this is much of a surprise. And, we're getting better. The world is getting better at understanding COVID over the past 6 months. But one of the key things that we absolutely have to keep in mind is the lag. The lag is real when it comes to cases. So when we identify cases, and then when we start seeing spikes in cases, and then later 1 to 2 weeks, spikes in hospitalization, and then within 1 or 2 weeks, spike in ICU, and then spikes in deaths. So it goes in that progressive order, varying days that you can have between. But we've if we've been following the situation reports and the JIC, you can see that actually in terms of our daily new cases, now we follow them on a 7-day rolling average. So we look at the past 7 days. That kind of brings down the noise in the variability that we have for different factors, like all the different labs that are running tests. But if you look at the 7-day rolling average, we've had about almost 14 days of a decrease in daily new cases on a 7-day rolling average. That's extremely important for us to recognize, because what that tells us is that what we're doing is working. It's working, okay? And so that, it's not one of those things where you jump out of an airplane and the parachute works. And then you say, okay, it's working, I'm slowing down. And then you just release the parachute. No, we gotta land safely. And so that's part of what we have to understand here. And the governor will make a decision about PCOR 1, and we'll discuss that during our 8:30 meeting. And we'll probably discuss it more in detail. But because we're seeing that, we haven't fully seen the peak in the hospitalizations yet, even though we've seen this, what hopefully is the peak in new cases. And with that peak in hospitalizations, with it being delayed, what's making it more likely that it's, so right now, the hospitalization looks like it may have hit a peak, and we were predicting that it might have happened on September 4. And it looks like that's what it was, because the total island-wide hospitalization for COVID was about 60 on that day. And then every day it's been below 60 in the 50s. But we're kind of in a plateau over the past several days now, for almost a week. And so that's the major contributing factor is the rise in ICU cases. And so that's the key thing that we have to understand. And then with that, obviously we've had our deaths, but because we just recently seen the rise in ICU cases over the past week or two, that unfortunately more deaths are expected because of that.
Doc, so when we talk about these triggers that we talk about here on the show, triggers to move us in between PCORs, one of the key ones is the hospitalizations, but then the other one is the testing positivity rate and the positive cases. Contact tracing. So I feel like when we talked to Public Health yesterday, they kind of had a better grip on the contact tracing. So with the triggers, different triggers that we have, and I know you guys advise the governor, but it's ultimately her decision. Do you think the PAG is in a position to advise easing of any of these PCOR 1 restrictions, or even a move from PCOR 1 to PCOR 2, even though the hospitalizations are, I would think, not in the stage where we can ease up. Because they seem to be like, if you look at the different triggers, the hospitalizations is probably the worst one, right?
Yeah, and so the key part is that if you remember the exact triggers, it was 14 days of decrease in daily new cases, and ideally below 5. You know, we're at 30 something right now, still. Our test positivity rate also, we want that below 3, and then the in terms of the doubling rate, you know, that's another thing that we've been tracking, of course, real closely, and that's the number of days it takes for us to double our numbers of COVID-19 cases. And right now we are at, so our worst was 10 days. It only took us 10 days back in the end of August to double our numbers. Now we're at 21 days. So that's a big improvement. We want to be above 30 in that sense. So right now we're in the process of revamping the triggers, you know, because this is an evolving thing, and we're learning from what we need to do to improve the triggers to inform a decision for the governor. And so the PAG is working that. Dr. Ricky Hernandez is doing that as well in terms of helping us design that. But you know, I think it's pretty clear when you start looking at the triggers that we had placed from the past that we haven't met that to go into PCOR 2.
Yeah.
And so, but you know, it's not as simple as just saying, okay, are we going to stay in PCOR 1? It's more, you know, we want a more surgical approach to this in terms of, you know, if there's going to be a change, we may still stay in PCOR 1, but what are the different changes that may happen within that? And so I think that's important, and we're, you know, we're focusing on, you know, there's been discussions about low risk versus high risk, services, and how we might want to, splice that out and have a different level. So that's being worked on.
Doc, so Gene had put a comment here. Sorry, Gene. Yeah, the ability to conduct mass testing is one of the triggers to move between PCORs. How would you address that, Doc? Because I know there was a huge shift because, and talking to the docs, part of it was because when they did the mass testing before, it yielded low positives. And so they opted to go for a more targeted testing approach because when they did the mass testing, the demand was so great that they just couldn't accommodate, and we all know this story, they couldn't accommodate the number of swabs that they got. And so there was a huge, 2-week delay in getting those results. So in your opinion, how key is the ability to conduct mass testing when we talk about it as a trigger to move from PCOR 1 to PCOR 2, or to otherwise ease up on any restrictions that we're currently under now?
Let me make no mistake in saying this, in that Guam is one of the areas in the country that leads in our ability to test, and we're extremely fortunate for that. And that's a combination of us being, territory that's just an island, that we get, the same share some states, as a whole get. We have the support of the private sector, and we have the support of the Department of Defense. And so because of that, we actually have a pretty good ability. So, yes, there are hiccups, and we expect to have hiccups, and we have to learn from that in terms of the mass testing. But right now, I'm counting 9 straight days of dropping test positivity rate. So it looks like we peaked around 11.8%, and then we're down to 8.2%. So our ability to test it right now is I don't think that's really a concern, in that we're doing, right now, technically, in a technical sense, you want to do more if your test positivity rate is high. But we're doing the other end of that, which is the lockdown, so to speak, the PCOR 1. And that's what brings things down so that the testing can match up. So the rate that we're dropping in our test positivity rate is extremely encouraging. And so we have to focus on that now. Will we do the same type of mass testing again? Probably not, because we learned from that. But also we have to understand that part of the monies given to Department of Public Health's lab is that there has to be an ability to test 2% of the population. So there has to be a portion of that is mass testing in order to meet those requirements for that program. So so you're going to see a mix.
I'm sorry, did you say we were going to change the 14-day period to a 9-day period?
No. What I was saying in the 9 days is I'm just looking right now at our test positivity rate and the trend that we've had so far and that over the past 9 days we've had a drop in our test positivity rate. So I was just mentioning that that's not about what we're gonna necessarily do. I think ideally we want to continue this and see this all the way down below 3%. But we passed the first hurdle, which was getting below 10%. When you're above 10%, the pandemic's out of control. Below 10%, you're starting to get control. Below 5%, you're doing pretty good, and then below 3%, you're very well controlled. And so we were below 3% for majority of the summer, and so I have a lot of faith that we'll get back to that.
And so is that what you guys are going to be talking about tonight? Changing these triggers?
Yeah, I think that's going to be a big part of the conversation, and we'll continue to work on that. There's different angles that people are making suggestions, and we'll review that. We're going to compare with other states also. I know California has a pretty good plan, but the key thing is the states that have done this successfully, New York being the best example. They've done it extremely slowly, and there was no rush. And I think that's the key point that everybody has to accept, and let's set that expectation now that that we have to be patient through this process and let it be a slow process. And so in that same time, which is probably difficult to sustain, but we have to really keep our eye on the ball, and that's protecting the vulnerable. Okay, I know we say that a lot, but I cannot emphasize that any more than I am right now. In that it's not just that you just say, oh yeah, I won't, if I'm sick, I won't go see my grandma or something like that. But even within the household, it's very important. We're seeing a significant spike in hemodialysis patients becoming COVID-19 positive. That's extremely concerning. And people, we say comorbidities, but let me be very clear so that everyone understands. We're talking about people with diabetes, with hypertension, who are on dialysis, with kidney failure, who have cancer. But what we're seeing, especially in younger people, is morbid obesity with the combination of diabetes. That too that makes you really high risk. And so we have to be very conscious of that. And morbid obesity is, again, it's not an opinion, it's a diagnosis. So people, let's get over being offended if your doctor calls you obese, because it's a diagnosis. Obesity means your body mass index is above 30, and morbid obesity means it's above 45. And probably at least 1/3 of the island meets the obesity diagnosis.
Doc, can you kind of go into that? When we asked Dr. Maglotny this the other day, but when people talk about these COVID-19 patients with the pre-existing comorbidities, there are some people who say like, oh, they would have died anyway, or oh, did they really die of COVID-19 because they had diabetes? And so there are people who are trying to dispute whether or not these deaths are in fact caused by or related to COVID-19. So just from the medical standpoint, and I know we've had this conversation before, can you just explain again, for the record, what happens when someone with a pre-existing condition contracts COVID-19?
Okay. Let me try and say it very simply, and then I'll follow up with an analogy. And the analogy that Chris, you and I had in conversation, off air, is that first of all, these comorbidities are already killing us. They're just doing it very slowly. COVID ramps that up. It speeds up that whole process. I mean, really speeds up from something that might take years or even a decade to a matter of a week to 2 weeks. So that's the first thing that we have to understand. But the thing with what's so disheartening is when people say, oh, they're gonna die anyway. What does that mean? I mean, who has the gall to say that about a human life, that especially somebody who is a productive member of society, and many of these people who have passed from COVID-related deaths are productive members of society and have loved ones and was still having the ability to have a quality life. So this is the analogy. So in a lot of these COVID-related deaths, we can never be 100% sure that it was a specific that COVID by itself was the one that caused the death, because COVID affects the whole body. But that analogy that I'm going to share here is, so let's say someone has end-stage cancer, stage 4, metastatic cancer, and they go on hospice, which is end-of-life care. But let's say an event happened, somebody broke into the house and shot them in the leg, okay? And they started to lose blood, and they couldn't survive that blood loss because they were such in a weak condition. So did that person die of cancer, or did that person die of a gunshot wound? The law is going to say that person died of a gunshot wound, and we'll prosecute that person who shot the victim, for murder. So why is that any different with COVID? I mean, it seems very clear when it comes to that analogy, because we can see a bullet, we can see the wound, but we can't see COVID. So that's a very powerful thing that we have to really understand, and that people survive gunshot wounds, but me and you, Chris, we may be able to survive that same blood loss, but somebody who's weaker is just not going to. And so that's the thing that we have to really understand. We have to respect everybody's different, varying ability to handle different challenges, and I think that that's something that is very important. I hope people start respecting that, because in the end, when we respect that fact, then we respect each other to a different degree that really helps protect our entire community.
I wanted to ask and talk about dialysis patients. Is there any reason to suspect that some of these dialysis patients are possibly catching COVID at these dialysis centers?
I think if I recall what they're in the cluster studies, that it's variable, that it's not just coming from one specific place, and that I think the rate that they're being infected is what you see amongst the typical vulnerable population anyway. So it's not like there's a one dialysis center where it's a major outbreak there. So this it's pretty spread around. So it's not like it's related to that. But again, we've always identified them on the top. I mean, I remember very early in this pandemic when we were looking at what was the potential for how dangerous this was going to be. There was even a thought of offering every dialysis patient, every comorbidity patient with significant comorbidities, a room at Leo Palace. And doing something like that to protect them. We didn't know if that was going to be effective. We didn't know, is that something that even makes sense right now? Probably not, because I think the family component is important, but it's also what the risk is as well. So we can and most people probably won't take that offer because they want to be at home, even if it's in a nice, comfortable setting. But in the end, we can make our loved ones comfortable at home, but we still have to, do our best to protect them. That means, if possible, using separate bathrooms and separate areas of the house, definitely a bedroom for themselves, and consistent sanitizing and wearing a mask within the house.
And Doc, so when we talked to Lillian, so now if you test positive for COVID and you're a dialysis patient, it's automatic 14 days in the hospital. And this measure was done to mitigate these positives from going to dialysis centers out here, right?
Yeah, it's really tough, Chris. It's such a tough position right now because it puts tremendous stress on GMH, and it's extremely difficult for them to have to handle that. But at the same time, the potential for an actual major outbreak in one of these dialysis centers is would be just awful. So we have to, so because of that, I know there's discussions about having a dedicated, one of the dialysis centers to be dedicated to those who are COVID positive, but are well enough to not need to be hospitalized and just need their dialysis. So that's I know there's there's some discussion with that. So we as you know, GMH right now. I wanted to just be sure I slipped a few of these facts in because it's important for us to understand that when you look at all the patients that are hospitalized for COVID-19 here on Guam, the percentage of those who are hospitalized that are in the ICU is about 20-some%, and that's about matches what the nation is for COVID. And so actually, I have the actual number right here. I'll put it in a second. So it's a 22% that we're seeing. The nation is about 20%, but those who are in the ICU that need a ventilator to be on who need to be on a breathing machine. The U.S. average is about 28%. Guam, over the past 30 days, 58%. In the past 7 days, the past week, 86%. That means that our people are extremely sick when they do come to GMH and when they are admitted to the ICU. They're extremely sick, and so much sicker than most of the typical COVID ICU patient in the country. And so that's something that we really have to understand. Everything we do is about protecting GMH, protecting the ability for GMH to take care of these patients. GRMC is rallied to do everything it can to support this. They're dealing with the non-COVID. Chris, can you imagine if COVID-19, if it hit Guam 5 years ago? GRMC didn't exist 5 years ago. And right now, they take care of a significant majority of the adult inpatients, and so I can't even imagine how what kind of state we would be if GMH was the only public hospital or non-military hospital on the island. And so we have to be thankful for what we have. We have to be grateful. And I think that's important. We have to count our blessings, and we have to count our blessings that technology has been a big advantage. Thank you so much for having the GNA's, bit with, especially with Paula. I think Paula's done a tremendous job at GMH, and she's really elevated the informatics part of healthcare. We work with her closely. I worked with her when she was a telemetry nurse and at GMH, and so that's good to give all these different perspectives.
Do you have any update on the skilled nursing unit? Is that finally open? I know that we got the FEMA nurses here, and then we got the 6 combat medics from the Guam National Guard over at the Guam Memorial Hospital. Is there any update?
Yeah, I don't have specific updates for the SNU. I'm sorry.
Okay.
Doc, we had a comment here, and it kind of goes to the targeted testing. Maybe dialysis patients should all be tested. Michael comments, I'm all for that, as my dad is a dialysis patient, and I worry about him every day. So we've done it before where we did the targeted testing of the elderly, the people with the symptoms, the frontliners. Do you think that we should do targeted testing for dialysis patients?
I think that that's definitely, and the PAG, I think the PAG and the state surgeon cell, I think have been consistent in saying that needs to be a priority. And they are doing that, but not in necessarily a systematic fashion, in that they're testing, as they come in and they see them, and they have an extremely low threshold to test. The question that comes up is how frequent to test them when they don't have symptoms, and that's where I think it gets even more difficult to answer that question. That same question can be posed for even healthcare workers, right? Even if we test all the healthcare workers on the island, like how frequent should we be testing them? And what does that do in terms of the equal distribution of that resource?
Okay. Anything else you guys going to be talking about tonight during the PAG meeting?
Yeah, and we're probably going to talk about the quarantine situation, I'm sure. I don't want people to mistake discussions for decisions.
Mm-hmm.
And so it's important that we have these discussions way early, even before we think we're ready to make any changes, because it takes a lot of time to figure these things out. So the different testing protocols, I got to tell you, Saipan has the CNMI has a very strict and very effective quarantine process. And, in discussions with them, it's probably going to mirror something similar to that. It's easier for them to implement that because of their size and their actual testing ability, but also that they don't get the same number of flights in, that Guam does. And so that's a very big difference. So for us to operationalize a similar protocol that the CNMI has, that's going to be, it's exponentially more difficult. But it's a model that we know works. And Saipan, in the CNMI, their healthcare system is way more fragile than Guam, and we're already fragile. So they have to be extremely more strict because there's, can you imagine if a similar spike like this happened there, and how tragic that would be. And, it really hurts my heart to even think about that.
Well, Doc, any secrets you want to tell us about the press conference today?
I think I spilled everything I know at this point. So,
all right, you got that Link Truth Serum. So that's 10 o'clock, right? And they're gonna
10 o'clock.
So from what you know, it's gonna be kind of the official unveiling of the Sarah app. And do you anticipate any other?
The Sarah app or the Guam COVID? The Guam COVID alert app.
Yeah, the COVID thing. I don't know. Do you
Go ahead. Can I make a very important point?
Sure.
And so that press conference is probably going to be very specific to that, but it's the Guam COVID alert. Mm-hmm. So the Guam COVID alert is for everyone, the entire island. Okay, and so Sarah alert is for those who are in quarantine and isolation. So let's be very clear and make sure we use the right language, because when we talk about apps and technologies,
I gotta go sit in the corner now, or what?
So the key thing is that with this Guam COVID alert is that the only way it's successful if it penetrates, up to a vast majority of the people on the island. We know that that there's a limited number of people who actually have smart devices, but they have to download the app. They have to open the app. They have to run through the things to ensure it sets up, and it's just mostly just saying yes, 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 and then that's it. And it's one of those things that protects your privacy, but it lets you know, and it makes the contact tracing. If you did contact somebody who was COVID positive that you don't even know about, it alerts you quickly so you can get tested and cared for quickly and potentially go into isolation. So it's a tool. It's not going to be the end all be all, but it's a major tool. But it's only going to work if we get the whole island to use it. So I don't know, maybe there needs to be more incentive, like you cannot enter Ross unless you have you have the app on your phone, something like that. But that's where the private business community can maybe step in and really help foster something like that. I think in China there was you can't get on the subway if you didn't have their app, downloaded.
Yeah, that's China though.
Yeah, exactly. Yeah. So that's the government saying that about the subway, but the business community can say that you see it everywhere here. You can't enter without a face mask, and that's the business community.
How about you can't get your tax refund unless you have the app? We'll see what Daphne thinks about that. Doc, last question here. A comment from Lauren chiming in on our Facebook Live feed. Sounds like it's going to be a while longer to move to PCOR 2. Everyone's hair will look so depressing. As a hairstylist, I believe my field is essential for everyone's personal and mental well-being. Agree or disagree, Doc?
I just want the pet groomers to open up soon so I can get my haircut.
Right. The pet groomer at least so essential. We'll get a twofer. Cut the dog, cut the chicken, and do the owner. Yeah, Doc. I know. Trust me. Okay. Thanks, Doc. We'll see you later.
Thank you, everybody. Thanks for your
okay.
Be safe.
7:40. Hey, we got to take a quick break. Come back with Daphne Shimizu of the Department of Rev and Tax at 7:41 is the link on the Breeze 93.9.
In this
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
T. Manabusan, Talafolfo in the house. Well, now I think she's over in Texas.
He's a big fan.
Yeah, I love this jam. I mean, if you look at the context of when this song came out, Let Me Be Me. This was coming out right around the time where the gay marriage was so controversial and people were talking about it. So to me, this song just hit hard. 746. Good morning on you. First Hawaiian Bank, Calvo Enterprises, and IT&E proud to present today's episode of The Link on the Breeze 93.9. We'll go back to the KUAM News Zoom room. Looking ahead, though, 8 o'clock, we have Jesse Mendiola. He's a recovery artist, and he'll be coming on to share his story. I know that Bree sat down with him. Was it this year, last year?
I believe it was about a year ago.
Right, yeah. So we definitely want to catch up with him. And then we've got Behavioral Health and Wellness, Athena Duenas. And we'll just do a whole thing on recovery treatment with Athena and the folks from the Lighthouse Recovery Center. That's coming up here on The Link the Breeze. Right now, though, here to do a reading from the book of Department of Revenue and Taxation. The director, David. What's up, Dav? You're kind of like...
Chris and Sabrina.
Good morning.
Happy day, everyone. Happy day, Jason.
You're kind of cathedral famous in here.
You know what? Cathedral has been our parish. We got married there back in 2002. We were the second ones to get married. My husband and I, we were the second ones to get married in the Chapel of St. Therese. So the cathedral is very important to us. And of course, in 2014, I began to be a lector there, and I'm grateful that, of course, Auntie Lulu and the team there who takes care of it all, that they're very excited to have me and on and allow me to contribute and serve. So, when Auntie Lulu calls and asks if we are available to read, I absolutely make sure that I take the time. It's a good way to serve. You know what? I'll share with you. In my past, I actually had been involved with other parishes where, I tried to assist them with doing financials and things, and that. To try to do financials during the day and financial work, and then try to do financial work kind of outside of that was pretty challenging. So it's nice to be able to be a lector and to contribute my time that way. And again, thanks for tuning in, because I know, of course, Archbishop, it's very important to him that we be able to share, of course, continue to share the Mass. And early on when we did, of course, shut down, back in March, and we were not able to attend Mass for several months. The first time that I was able to go back into our church was so emotional. And actually, even the first time I watched, and thank you to KUAM, your stations, because, you guys have been so supportive of making sure that, you stream and you get, the Masses out to our people. But, the first time that I actually watched our Mass on TV, I was very emotional. I was very emotional because the reality that we can't step into the church and be with, be there to share and service together, and to, praise God together. That was very, very emotional. So, it's great that we're still able to do that, and to make sure that, especially those people who are health compromised, and of course right now, because we're not able to actually attend Mass within the church, we're doing parking lot Mass right now. That is great to get that out there, and to have people be able to participate in something that's hopefully uplifting and keeps people focused on I think Dr. Cabrera might have said it earlier, probably is, we just kind of have to continue to pray. And I think, that's kind of been our theme, and hoping that we can continue to, keep people focused on things. It's a challenging time, Bree and Chris, and that. And, of course, our jobs outside of what we normally do, if we have the opportunity to serve, I think that's very important. So, but I know that you guys want to talk to me a little bit about Mangafa. I know that that's probably, I think, one of the larger questions that we have, and that's the Ajuda y Mangafa Help for Families program. We talked a little bit about that in the last couple of weeks when I talked with you a while ago. We did, Reverend Tax, we did work to make sure we follow the law, and we did provide draft rules and regs back in August 11, and that was within the time frame allowed by the law. At the time that we did provide those, we did, though, give notice to the legislative body that there were some issues that we believe that existed with the language, which we believed was important to adjust, just so that way, the law truly addresses and will pay the people the way that, it was intended. Last week, September 2nd, I believe, when our legislature, I guess, was finally done with budget talks, they were in session. During that time, Senator Shelton did introduce, or was able to get, the Ajuda y Mangafa amended bills and rules and regs onto the session agenda. So we were able to adjust those. Of course, when we did submit our original rules and regs, we based it on the law at that time. We also, I guess, had to work to make sure that we, in the event that there were changes in the law, that we were able to make those changes, right away. We've had to try to be as agile as possible. So we made those changes, and we were able to get those in, and we're thankful to our legislative body. The changes, and that was Bill 392 and Bill 393-35. Those actually were all voted on in session, I believe, on September 2, and those were there. It was unanimous. All 14 senators who were present, voted in favor of it. Of course, this is something, again, that we're, working to make sure that we get out to our people. The idea behind the Ajuda y Mangafa was, of course, to address the issue of, the gap that was left by the CARES Act, we know that back in March when President Trump signed, the CARES Act, of course, we know that there was a lot of pressure for Congress to get, the CARES Act passed, and there was so much involved in the CARES Act, and it wasn't until weeks after the CARES Act passed that it was discovered, or it was, there were certain gaps identified, and, those gaps were for those families who had students who were in college, if they're up to age 23, and then also those families who had dependents who were disabled. And, even as we were processing EIP, I got called from friends, family members who have dependents who were, disabled, but they were not qualified for EIP because they were over age 16. And for those people, they were not able to qualify. And so again, this particular program helps to bridge that gap. Now, on the rev and tax side, and of course the governor does have, I believe, until Monday, this coming Monday, next Monday, that's the 10th day after session. I believe how it's counted is it's calendar days, but you discount Sundays. So, I haven't had the opportunity to meet with Governor on this. Of course, I have discussed with Governor's Office Legal Counsel, briefly. And on the DRT side, what we're doing is working to lay the foundation for, a quick implementation. The way that the law is structured is that DRT has 15 business days from the time that this becomes law to implement. We are definitely not going to wait the 15 days. We're trying our best to get it all laid out so that once it becomes law, we're ready to pull the trigger. Chris and Sabrina, we know, we see every day our people suffering. And, I think, there's this balance that we're trying to make. And, we just saw heard about our 21st fatality and due to this virus. I want to say condolences to all of the families, to Mayor Salas from Assen. And, I think that the sharing of his story, his daughter passing, and, that was very moving, obviously, and to hear, from Dr. Cabrera earlier about the people that we have, in our ICU. And, I've been hospitalized myself. I know how scary it is to be hospitalized. I know that, to have, your family or somebody there to support you is important. And I can't even imagine what it's like to be in the hospital and not to be able to have your loved ones, by you. And, I'm sure it must be very scary. So, we definitely have to be praying for all of those families. And so, from DRT perspective, we do have people that are activated already to prepare to lay the foundation so we can implement this program, because we do recognize, again, we have a lot of people who are in need, and it's a very challenging time for many of us. So, in regards to Duda Mangafa, we do recognize that, of course, we are currently in PCOR 1, and we're at Rev and Tax. We actually have we've identified, I guess, two types of PCOR 1. We call one relaxed PCOR 1, and the other we call restrictive PCOR 1. And relaxed PCOR 1 is where we're actually able to activate people in the office. Our collections person is at the Treasurer of Guam down at ITC building, and we actually have active people checking the mail. Restricted PCOR 1, we are calling it restricted PCOR 1, and that was, of course, when the Treasury was closed, and really we were trying so hard not to move any people at all, and so almost nobody was mobile in our office. And so, during this relaxed PCOR 1, we do have people activated. We have people in our income tax section, EDP, central files. We have our business license group who is also working to support some of our enforcement measures. We have our enforcement group who also supports public health and works on identifying essential and non-essential businesses and working to address that. We have our real property group who's, of course, working to get our real property tax roll certified in October, because we need that so we can send out our notices in December. We have so many people. We have our driver's license group, and I want to thank you for getting me on and allowing me to talk a little bit about our driver's license form. I'm happy to say that people are actually doing renewals by mail for our driver's license. I think it's exciting because, now people are able to actually submit their forms. People have been sending it in the mail, dropping it on our Dropbox, and our team is able to now go in and, not customer facing, be able to process somebody's, driver's license and to get that out. I'm sorry, but I know I'm skipping around a little bit. I want to talk a little bit about Mangafa really quickly. I want to share, I was able to talk with Executive Director Angel Sablan from our Mayor's Council. I want to thank them for always being supportive. When we did have EIP, our mayors made sure that they had available all of the EIP forms at their mayor's offices. So, Executive Director Sablan already had advised that once we do have the forms available, and our team is working hard to finalize those forms now, but once we have them available, that he will distribute those to our mayors so that, of course, our people won't have to go too far from their homes if they are not able to get the forms or print them. I also asked him about, of course, the capabilities of our mayors and if there are, access to computers for our people, at the mayor's offices. And he said that's something that's being worked on. So, even though we haven't yet implemented the Mangafa program, we're working to lay the foundation, and we're trying to make it so that once it's ready to be implemented and we're fully pulled the trigger on it, that we're ready and the forms are out. And so those are all the things that we're working on Mangafa. I want to share though with you something that we haven't done a media release on yet, and this is actually probably the first media outlet that we're going to share this with, but we already have launched also, and I find this exciting. I know it might be something small, but for those people who have already passed the written exam, if you have a child who's passed the written exam and they need their permit, we've actually launched the form for that. It's already on our website. We're calling it a mail service form for permits. And we, so for people who, again, if you need a permit for your motorcycle license, instructional permits, and your permits because you've just passed your written exam and you need your permit so you could drive, you can actually do that by mail now. So, these are all things, for me, progress is happiness.
Right. Daph, you keep answering all the things I was going to ask, but we're just going to come.
Another question.
Yeah, and we wanted to ask.
No, but for me, every step that we make forward is helpful. So, we really, I've challenged our team, and I'm grateful that they're receptive to it, but we're really working to try to move forward and try to get as many things to be non-customer facing so that we can, help to reduce this spread or prevent exposure, but still somehow provide some balance so that we are able to still provide service. And, that's really, for us and, Sabrina and Chris, I think I mentioned this before, that this restricting or this kind of tightening and relaxing, this is going to be our normal, for a while. Even if we do get a vaccine, I've talked with some people who are not, willing to probably be the first people to get vaccinated because they're also worried about, the potential side effects that may happen.
Daphne, let me ask you about this. The $65 million, I understand, Section 30 funds, you guys received that. The announcement came from the Department of the Interior. And as we all know, the 2017 National Defense Authorization Act, a portion of that money is supposed to go to war claims. Do you have a figure on how much of that $65 million is going to be going to pay war claims?
No, Sabrina, I don't have that amount. My understanding is that, of course, that the Section 30 monies that we receive because of the Foreign War Claims Act is going to be capped at a certain level. That's because, of course, monies are going to be set aside for war claims. Now, in terms of how much that is, I don't have that amount, and perhaps that's something that Director Byrne or Director Carlson might be able to share. But we have, for me, I actually have been in communication with the Department of Interior and the IRS because we know that around this time is when we do begin to receive those monies and of course get the notification of the cover-overs to Guam.
Daph, let me just bust in here real quick. To our viewers on KUAM TV 11, thank you so much for watching and listening to the link on the Breeze 93.9 or KUAM FM and Hagatnia, Guam. Again, TV 11. Jump on over to our KUAM News Facebook Live or, again, the KUAM News app, KUAM.com, or right here on the radio. It's The Breeze 93.9. Daphne Shimizu, Reverend Tax Director. I don't even know where to look at what camera. Let me just, hey, right on. Yeah, there you go. Sajos. Daph, if we could just on the tax refunds, we're getting a lot of comments. So what's the status of the payments? Are we complying with the court order? Because I keep seeing a lot of chatter here. So just if you could.
So with regards to the tax payments, we are actually, refund tax payments, we're actually at February 10 as of last week, and every week we do process. And so, we continue to process every week. Of course, our charge is to make sure that we do follow the requirements of the permanent injunction, which require that we make payments within 6 months of the due date, or the date that, the due date or the date that is filed, whichever's later. Our team is, that's their charge, and that's, something we make sure that we do. If people run into problems, if they believe that, that's not the case, we do have people who are at the office, and we do have people who are answering calls so that we can make sure that we're working to make payments, timely to our people. That's something that's been very important. I know even in the last year, as we've been working, again, to make sure we've been paying, early on last year in 2019, we didn't really have a system. It was, there were points where my team would, come to me and advise that, if we didn't make a payment within a few days, we were going to be in violation of the permanent injunction. And that's why, we work to, have a systematic way of making payments, which is, of course, the weekly payment structure. During this shutdown, we actually have, we missed a week 2 weeks ago, but what we did was we actually had 2 check runs last week. We had one right in the beginning of the week and one right at the end of the week. And so, our charge is to make sure we follow, and that's, of course, what we, do our best to work to do.
So are we, February 10th, you said we paid up to February 10th, so the 6 months would be March 10th, right? So we're a little bit behind?
No, so it's so how it works is it's 6 months from the due date or 6 months from the filing date, whichever's later. And so, usually in a year, of course, this year the due date was July 15, but usually in a usual year, that means 6 months from, we start counting at April 15, and that's because it's the later of the dates, and it's actually when a return is A status. So. It's very important, Chris and Sabrina, people submit their tax returns, but they don't attach their W-2s. They don't, complete it properly. Some people don't sign their returns. And we notice that some people even, fill out their returns using pencils sometimes. So, those are things that, it's very important to be mindful. If you submit an incomplete return, if you don't have proper attachments, we don't start counting because it's not a complete return. And that's going to be, again, very important. And I know, there's a lot of, awareness and education perhaps that has to be done. But, we do see that those as cases where people aren't signing their return or not providing the proper documents. And those are the things that perhaps may cause some delays.
How many processed refunds are waiting for payment for 2019?
I don't have, what we do is we submit to and let's see if I could find it. We submit to the legislature, of course, our refund liability report on a monthly basis, and it's due on the 15th of every month. I was just actually looking at our refund liability report earlier. So I do believe that as of July, and our next refund liability report will not be due until September 15. So our team is going to be working on that. But if you just give me a second, I can tell you our refund liability report for July. I was just actually discussing this with my team. Okay, so for 2019 returns, we have seen, and actually we have processed quite a few already. Sorry, Chris and Sabrina.
Well, you finally slowed down.
No, so excuse me because I get very excited. And,
I know, Dab. I know.
Because I tend to talk very quickly when I get excited. But But so for 2019, as of July 31, and we ran this report August 1, we had received 44,199 returns for 2019. Of those, we have paid out for 2019 returns as of that time, processed and paid for 2019 returns, 33 million. I know that Director Byrne was on the radio the other day. I did talk with him the other morning about our refunds, because as of September 4, we actually have paid out 87 million. But as you know, what happens is, there are still some refunds from prior years that are being paid, even though we're, as we go along, we're still paying out some prior year returns, or refunds. So we have paid about 33 million in 2019 returns as of July 31. But I know that in total, we paid about $87 million this fiscal year for total returns for all years.
And you talked a lot about MNGOFA. When are the payments going to go out, or do we have to wait for the governor to sign a law, the two bills?
So, the way that the bill is structured, and this was something that both Senator Teichler and Senator Shelton did talk with me about, was, because the law the original law, and then even this amended, the original law did not have an actual implementation date. The original law only addressed an application period, and the application period is a 30 business days period. 30 business days from the date of implementation. Right. So the current law actually states that the implementation date is no more than 15 days from the date that this becomes law. We're not going to wait until, of course, the 15 days. We're not, in fact, we're not even waiting until, of course, governor does sign, to be working on the background to try to get these out. We've already, We've already, again, in terms of the rules and regs and what's involved and what's going to be required, those information is already pretty much available in terms, at least in, if we look at the bill 393-35, the amended version, we had tried to make it very clear in the rules and regs exactly what was going to be involved. And so, those are things that our team, as soon as, actually, we are just trying to finalize certain things,
but this is still a CARES Act money that's going to be used to fund this MNGOFA program.
So the way that the law is written, it's, and excuse me, do you mind if I just look really quickly? Because there is language in the law, and the language in the law states that as long as there's still, hold on, media. It states that no local funds may be used for the program as long as CARES Act funds are available to encumber, obligate, or expend. Now, the source of the funding, that's something that, of course, I have discussed and advised DOA and BBMR that, these are, the source of the funding is not actually DRT's technical. We're not the SMEs on that. The source of funding is really, determined, of course, by the cash flow management. The people who are primarily responsible for cash flow management, and that's DOA and, of course, BBMR. Our side of this this program is just making sure that we work to administer. So, there was language, Sabrina, to answer your question, there's language in the law that, of course, refers to the CARES Act funds, but the actual source of the funds is something that I'm not sure.
Man, I just wish.
I remember the debate on session floor and the arguments about it, because they were saying that the 10 million would come from the CARES Act funds, and then there was a whole debate on why are we even bothering with this bill, because you don't legislate
CARES Act fund spending, money. And they didn't even do it right. I mean, I just like the whole thing. So like Senator Shelton should have got this right the first time, and unfortunately, people are waiting because she didn't, and now we're still waiting. So, that being said, Daph, I'm sorry. Can we just get one real quick update on the economic impact payments? How many more of those do we have?
On the EIP payments, we're, again, we did miss the 1 week when we were in restricted PCOR 1 because I had nobody in the office. We did process EIP payments last week, and we'll process payments this week. What we're seeing is the payments, I believe, are in the just a little bit, they hover over like in the $1 million range. We're going to continue to pay those. We have until December 31 to make all of these, what they're called advance payments, meaning the payments that are going to be made for eligible taxpayers that's not going to be made when they file their return, because there are going to be some people who may not be eligible now, but may be eligible when they file their 2020 tax return. Thank you for bringing this up though, Chris, because there is a deadline for filing your forms EIP&F and filing your forms 1040 if you're eligible and you wish to receive those payments before December 31 or by December 31. We're charged with making sure that we make all these what are called advance payments by December 31. Of course, because of, we're primarily a manual processing system, unlike the IRS, which is, 80 to 90% perhaps, as I've heard different numbers, that they are at that level in terms of electronic filing. We started off having probably it was like 1,200 to 1,500 people a year out of about 70 or 80,000 filings. That was the level that we had in terms of online filings. Now we're seeing that grow, of course, because we're working to expand what's available. But again, please, if for our community, if you're wanting to receive your payment by December 31, and that you are eligible based on your 2019 or 2018 validly filed and processed returns, that you must get those in by October 15. Otherwise, you will have to wait until you file your 2020 tax return to receive it in that in that payment. But we're going to continue to pay. We've been assured, of course, by the IRS that as long as there's eligible payments, that we're going to be processing, that those individuals are going to be paid, and so we continue to process them. We continue to pay them out as soon as they are ready, and of course we have people in our office, making sure that happens, and that's where we are with EIP.
Thank you, Daph. Thank you.
Thanks, Daph.
Thank you so much for your time. I love how you just fit so much information. You're giving like 3 times the information per minute our other guests give.
Have us, Chris and Sabrina, and bless you, and really, to our community, thank you for your patience, and know that we're praying for you, and of course, DRT stands ready. We're here, we're public servants, our team is there activated, and we're going to always do our best to serve you all. So thank you for all you do, Chris, Bree, Jason, KUAM, and again, have a great day, and we'll talk with you very soon.
Thank you, Daphne. I'll see you in
Thanks,
Mass.
Daph.
Are you reading this week, this Sunday?
No.
No. Okay. There you go. We'll see you in the comments. Right on. Thank you, Daphne.
Take care.
Okay. 8:14. Let's just keep it going. Back to the KUAM News Zoom room, where we have Jesse Mendiola, who was just so gracious to take a little bit of time off work to talk with us and kind of touch base again. Jess, good morning.
Hi, Jess.
Good morning, Chris. Can you hear me well?
We can hear you well, yeah. So thanks for joining us. Tough act to follow there, the Reverend Tax Director. Jess, so we wanted to bring you on, and I know Sabrina had talked with you, I know last year, to touch on your recovery journey, right, Bree?
Yes. Good to see you, Jess.
And Jess...
Good to see you, Bree. I can't see you guys, though.
Oh.
No way.
It's okay. You're not missing much.
I'll turn on your camera, yeah.
My camera is on, but I can see the glass. Your glass.
Okay, that's too bad because I shaved today, man.
Yeah, there.
Okay, good.
All right.
So, Jess, we wanted to because we know you had told the story of the journey and the bus, the jail time, the drugs. But when we had talked about doing this interview, I thought it was really interesting because you said, Chris, we spend so much time telling people to get sober, but a lot of times we don't tell them why they should get sober or what life is like on the other side, what life is like living sober, right? So let's just catch up there. And I feel like a lot of people know your story. So when you got sober, let's talk about how your life changed.
Go ahead.
Go ahead.
Go ahead.
You go ahead.
Okay, I got sober while incarcerated. I was incarcerated in federal prison in 2015, and I started to rethink my life and where I wanted to head in life after I got out. Obviously, some people use prison as a time to reflect on their thoughts and rediscover who they are. Other people use it as a way to garner more connections, as to educate themselves on how they can further enhance their criminal career when they are released. I took the former as opposed to the latter. So I sat down with myself and I just had a plan. I told myself I can't create any more excuses when I get out. And I realized that the biggest opponent I have in my life are my own thoughts, because that's the biggest challenge we have, is fighting our demons. So I instituted a plan while incarcerated, and it's up to the individual themselves where they want to go. I had dreams, I had aspirations, and I had hopes as a child growing up. And I continued to hold on to those dreams and aspirations, but I didn't want to take the necessary path of hard work to attain those dreams. I wanted to take shortcuts. And that's the thing in life. If you take shortcuts, you're not going to get the full taste of everything you're getting. You're not going to feel the same way as you worked hard for it. So I told myself about to my addiction. I had my addiction for what the demon is in itself. So when I got out, I told myself, okay, 9 months before I got out, I called up my old boss and I told him, I said, boss, I'm getting out. Do I still have a place of employment with you? The first thing he said is, are you done with your BS? I said, yes, I am. He said, okay, you're a great worker. You have great work ethic. When you get out, come on over, give us a call. So already I laid the groundwork right there. And then I was wondering, a lot of people get released from prison with financial difficulties. That wasn't the case for me. Sadly, my father had passed away, and he left me some life insurance money, which gave me a leg up on my release. So that's where I had a leg up as opposed to other people getting out.
Right.
But the blessings continued to come throughout my sobriety, as long as I stayed true to myself, became very teachable, and continued to be humble. Matter of fact, before this conference call, I just called Miss Val Rages up from the Lighthouse, because she's my go-to. Val is my go-to anytime I'm going to go on the radio or do a show or have any questions, comments, or concerns. And she always puts me in check. She keeps me level-headed and reminds me of my place. So she told me, she said, Jesse, you're going to be that voice that's going to help people out there. So, the blessings that come with sobriety, a lot of people are lost along the wayward path, and they trying to find their way is often difficult because they're having a hard time letting go. I want to use an analogy. When you're driving a car without power steering, it gets very difficult to steer. You're exerting, an enormous amount of strength just to try and steer that vehicle to stay on course. Life is a lot the same way. You got to be sure to maintain your overall well-being so that when you travel this road in life, you can enjoy the journey. You can enjoy the struggles. You can learn from the pain, and then you can smile through it all. So that's what I did. Since I've been clean and sober the last 4.5 years, my life has quickly turned into so many blessings, and it's difficult for me to say these things without sounding arrogant, but it's how else can I get my blessings out there for people to see that there's so much life after addiction. When I got out, I was single for a year. You have to maintain that isolation so you can learn to love yourself and understand who you are as an individual. If you're early on in your recovery and you cling on to a relationship, you're going to use that relationship as a crutch. It's going to be a self-dependent, a codependency now. You got to be able to depend on yourself and your higher power alone, because that's the only way you're going to get through it. Because not everyone's going to be there for you when your struggle is occurring. So after that first year of being single, I maintained my employment. First thing I did, 3 months out of prison, I got a car with no credit, just a little bit of a down payment, and I got a brand new car. So, okay, God's telling me, you're doing great. This is a blessing I'm going to give you. Continue to stay true to yourself, and honor your sobriety and your recovery. A year and a half later, I got married. Boom, another one. These were the dreams and aspirations that I had growing up. The minute I started being true to myself, everything started falling in place. I did not have any more excuses. I owned up to every single mistake I had in my life. I took responsibility for it. I tried to make amends to all of those that I've hurt in the past. And things have been working out. Now, the biggest blessing of all is I'm about 3 weeks away from closing escrow on my very first home. Though I was gifted a home by my father, I wanted to create my own success after sobriety. And everybody is entitled. Everybody has that desire and that strength in them to seek out a better life. It's all determined and dependent on how bad an individual wants it. Mm-hmm. If they want it bad enough, they will get it enough. You can't force somebody to get sober. I was in treatment at the Lighthouse for about 3 or 4 times. Every time I went there, I was only kidding myself. They provided me all the tools that were necessary for me to have a successful recovery. The problem with myself was I never opened up that tool bag that they gave me and utilized the tools. But in another sense, what's the point of having the tools if you don't even know what tool to use? So, the beautiful thing is the seeds were planted early on in my recovery. It just took some time for me to water it in order for it to grow into what it is now. What's next for me is, I work in an industry where I can, reach out to a lot of people who are afraid to seek treatment, because I work in the construction field, and many people know in the construction field there's a lot of active, users in the construction field. And my presence here offers them some light, some hope, some perspective, some guidance on things. And just as recently as a shout out to me on Facebook because he saw my interview, it said, "I saw your interview and I need help. I need help. Can you help me?" So I talked to him for a bit, and I directed him to the proper channels because I am not a counselor. I am not a certified specialist in any way or means, but I am the conduit, if you will, to direct them into where they can seek treatment and where they can seek help.
Right.
I want individuals out there to know that when it rains, it pours, right? Mm-hmm. Now, it depends on what type of rain you're going to experience. Do you want to experience a thunderstorm of stress, of anxiety, of negativity in your life, or do you want to experience the joys of rain? The rain of joys, if you will, because right now the blessings will pour upon you nonstop as long as you continue to be true to yourself, take responsibility for your actions, and want better for your life. Because ultimately, an addict thinks that they're only hurting themselves. I'm sorry to say, your loved ones are hurting more and suffering more than you are. And we have to learn how to put our selfish desires aside. But in retrospect, talking about selfishness, when you're in recovery, I was told that you have to be selfish because it has to be about you in your recovery and you alone. But once your recovery has garnered that foundation and that strength, then you can branch out and you can do things for people. It's just life has just gotten so great these days, and I continue to use Facebook and social media as my outlet,
right,
to reach people. Already a lot of people know my story, so it gets kind of redundant for me to continuously repeat my story. But if I can't laugh about the journey I've been through, then what's the whole point?
Right.
I can laugh about where I've been through and what I've gone through because it's made me who I am today.
Jess, you gave some very, very eloquent testimony. I remember there was a game room bill, and so you definitely not just talk the talk, but you walk the walk. I want to go back when you talk about it rains, it pours, and not talking about a rain of blessings, but we've all seen it. We all have those family members who just struggle with drugs. Most of the time it's crystal meth, ice. But how many times have we had that instance where you're just so proud of your family member or you're someone because, man, they've been doing good, they're off the stuff, and then, boom, Maybe a pandemic
Yes.
hits. Maybe they're stressed. Maybe, and then they're back on it, and it's just that letdown. And we've all felt that, like, God, he was doing so good.
Yes. Relapses. A person will relapse in their mind before they relapse in real life. I've learned that in recovery, because once you have that thought of a relapse, you're going to feed it. You're going to continuously feed that thought. You have to have. Miss Val told me this trick. She puts to put a rubber band around my hand, and every time I have a thought of a relapse, to snap that rubber band back so we can change my train of thought. Now, relapses, especially in these times of COVID, it causes people to be desperate. Many of them are out of work. Addicts who found their way out possibly get pulled back in because of the simple need to provide. Now imagine getting everything you have in life, doing things the right way, by getting sober, getting a job, then an unknown force comes in and threatens all of that. It's dampening to one's thoughts, to one's spirit. They place all that hard work and the possibility of losing it all forces them to return to what they know. And that is a life of selling drugs, using drugs because they can't handle the stress. And then often they'll lie to themselves. I'll sell this, make a little money just until COVID is over and I return back to work. I can't fault them for that. People need to survive, but here's the thing. Once you get back in, it may very well be your last time. It may very well be your last breath, because you could just, you lose your life right then and there. So to put things in perspective, if an addict has hit bottom more than one time, you've rebuilt your life more than one time. There's no need to go back to that type of life, because you've already been at the bottom. You know what it takes to rebuild. This is just a different sort of bottom. Now your strength is gonna be tested, your sobriety is gonna be tested, and your faith is gonna be tested. This is where individuals need to reach out to centers like the Lighthouse Recovery Center, Oasis, Togi, and Guam Behavioral Health and Wellness Center, because those individuals will remind you that you are not alone. They will give you the tools that you need to not find yourself in that rut, because there are a lot of people out there relapsing. Suicide the suicide rate is high because the stress level is overwhelming for them. I say this: call me up on Facebook Messenger. I will not give out my personal cell phone, because that's a personal cell phone. But call me up on Facebook Messenger, and I will help you out the best I can. Not monetary wise, but I will offer you some advice, some hope, some inspiration. And I will point you in the right direction. Because no matter how bad life gets for me, if I lose everything right now, I will not resort back to selling drugs. I will not. That ship has come and gone. Right now, I am setting sail for better seas. And yes, the seas will get rough. When it gets rough and I get very lethargic, I just pull over to a port and just rest. Rest easy, take a minute, breathe, say a prayer, and just trust the process. Trust in God. Now, words are very easily spoken, right? People be like, it's easy to say, but it's hard to do. To me, that's an excuse. You are going to make it hard to do. Get out there and make it happen. Construction industries are currently hiring people right now. There's openings in so many different places. The thing is, a lot of people got to put their pride away. You go from making $3,000 a day to making $150 a day. But here's the thing: you're earning that money. You're not hurting anybody in the process. You're doing things the way life was intended to be. You're earning it.
Jess, thank you for the pep talk. I know you had 30. It's 8:30.
Yeah, my boss walked in and said, "Oops."
Yeah.
And walked right back out.
So we actually have Val and Athena from Behavioral Health and Wellness. We have Jeremiah, the peer recovery specialist, and Chris, the clinical supervisor for Lighthouse Recovery, coming on in a few minutes, and we'll just carry on the conversation with them.
I talked to Jeremiah this morning. I was going to give out the numbers, the Miss Val Rages' phone number, right, and New Beginnings' phone number, and Guam Behavioral Health and Wellness Center's phone number. But since they're going to be on right after me, I guess they can reach out. Jeremiah knows me very well. Jeremiah and I used to party back in the day. So to see another fellow brother of mine get out from the darkness of the streets and enjoy basking in the sunlight of happiness and success, it's further proof and testimony that there is life and hope after drugs. There is recovery. Recovery works. Treatment does work. We are living proof of that. With rocks like Athena Duenas and Val Regis to keep us in check. Hi, Miss Athena. There's Miss Athena right now.
Yeah, let's pop her on. Yeah, we got Athena Duenas. So we kind of want to bring you on first, Athena, just to pave the way. Athena Duenas.
I was at the Lighthouse, right, 4 times. And booked this one period in time. So I had to go to New Beginnings. And Miss Athena was my counselor at New Beginnings. And I'm a difficult client, if you will, because I can speak. I stressed out. Miss Val told me like it is. She's a no BS type of woman. She holds me accountable, and she would, if she ever found out I relapsed, she would go to whatever house I'm at and pull me out
by the ear.
Yeah, by the ear, and she would have Miss Athena in tow. That's the type of the 2 women out there who I would always turn to no matter what if I ever have any questions, comments, or concerns. And part of my strength in recovery is due to them not giving up on me.
Well, I know there's a lot of people, they don't give up on Jess, and we're going to go ahead and jump into the conversation with them. I know you got to get back to work. Thanks for taking time off to share your story.
Thank you. You guys have a great day.
You too, my man. There you go. He's on Facebook. And again, if you want to give him a call on the Facebook Messenger, he probably won't answer now because he's got to go back to work. But yeah, it's Jesse Mendiola. And I like how he talks about recovery and, it tells people what's very possible when you achieve sobriety. So we'll go back into the KUAM News, the Zoom room, where we're going to start with Athena here. And Athena, if you could, just tell us a little bit about, because I know it all kind of starts from Guam Behavioral Health and Wellness Center, and then we do the sub-grants out to the Lighthouse Recovery Centers, the Oasis Center. So let's just start with GBHWC and your role in the front lines of recovery on Guam.
Hi, good morning, everyone. Hey, Sabrina and...
Good morning.
Thanks for joining us from San Francisco. I didn't know we were going to get a long-distance call.
Well, I have a house full of kids. They're going to be walking by. Yeah, so, we've been running every month for the last, 20 years. So we started in the year 2000, and since we started contracting with our partners in the community since 2004 and 6, we started to build this partnership for Recovery Month. So every year we all sit together and we start planning. We plan early, especially because we have Valerie, who kind of pushes everything and says, we need to start planning now, and it's December, and we just finished Recovery Month in September. So that's what we're doing every year with our partners. We sit as a committee and we invite peers to the table to sit and be a part of the planning for Recovery Month. It's a little different this year.
Yeah.
It's not as Recovery Month is meant to be very social, so it's a little bit difficult for us this year because we know that really our connections are just through virtual meetings and talks and things like that. So we're working on getting used to that change. But other than that, yes, Guam Behavioral Health and Wellness Center has been at the forefront of starting up recovery.
Water, whatever.
Thank you, Athena. We're going to go ahead and fold in Val and Jeremiah. We have Valerie Regis, who's the Lighthouse Recovery Center director, and Jeremiah, who's a peer recovery specialist. Good morning. Good morning, Val. Good morning, Jeremiah.
Good morning.
And hi, Val.
Good morning to the dog.
And good morning to the dog, too.
Yeah, I got a couple of dogs here.
That's okay. They sound talkative. We'll just start with what you had said, Athena, and I kind of want to dovetail off that. PCOR 1, pandemic, coronavirus, I'm sure a very, very integral part of the recovery process is being able to, like Jesse had said, go in and see the people that you're trying to help to, do those spot checks. Hey, surprise. To get that face-to-face interaction. So how have you guys had to evolve during this pandemic to continue to provide those services that you provide? I guess Val will start with, or go ahead.
I mean, we're just doing it how everybody else is doing it. You know, we have to do the virtual thing if possible. Even if that means if it's not virtual, then we do by telephone as much as we can. But I know the Lighthouse. I know it's different for our peers though, because our peers really, they're meant to be face to face, and we do have some peers that they still go out and they still check on clients. They try to be as protective as possible with the gloves and with the mask and 6 feet, but they really will go out and check our consumers. But with treatment wise, we have to provide it the best way we can, as virtually as we can.
Val?
Anything to add, Val?
Morning, Val.
Hi, good morning. Good morning, Guam. Shout out to the Lighthouse Recovery Center.
LRC.
They're all excited.
Yeah.
We have a great group of clients. I think they're all perfect. They are allowing the Lighthouse to continue to provide treatment. They're under lockdown and they've been really keeping it together, monitoring them, and we've gone remote for our outpatient clients. We continue to drug test because that is a very integral part of treatment. And we have the ability to safeguard individuals when they come to test. So we're continuing treatment. Treatment hasn't been stopped.
It's essential.
We have our contract under Guam Behavioral Health, and we have a capacity of 28 beds, and we have quite a few beds filled at this point.
Nice. And also joining us on the Zoom, we have Christopher Francisco, the LRC Clinical Supervisor. Good morning, Chris.
Good morning.
Jeremiah.
Morning, everybody.
Morning. I wanted to take it over to Jeremiah as the peer recovery specialist, right? And I talked about this with Jess before you guys came on. During this pandemic, people may have, got it together, right? May have turned that corner. Here comes COVID. Lose a job, lose a life, how hard is it? And are there the success stories when you go around and you check on your peers?
Well, it's extremely hard. One, because with recovery, human contact is very important. A lot of us are huggers. We like to hug, and one of the things that's a real challenge for us is being able to have that face-to-face human contact. So we do the best we can, dealing with our peers that we work with and whatnot, regarding observing all of the safety measures as far as what's working COVID. Yeah, so and for our peers, it's definitely affecting a lot of their recovery. As far as their mental health wise. Because as we know that our crisis calls have gone up 2,000% since March. And that's a real big thing. So there's a lot of stress that we got to deal with one day at a time.
Chris, let's go ahead and check in with you on the clinical side of LRC. What are you seeing during this pandemic?
So the pandemic and the isolation. So isolation could be a big trigger for a lot of our clients. Now, there are avenues in order for positive coping skills. Like I know that 12-step meetings are being held online. That's one of them. Also, if our clients want to make contact with us, we can do it virtually via Zoom or via phone. But it's another one of those life stressors that people have to contend with when they're in recovery. It adds on something else that they have to cope with. But if they work their program, I found that a lot of our clients are able to maintain their sobriety despite the COVID virus and the lockdown. Plus here at the LRC, we kind of have, we work the Salvation Army has the food bank, and we have other services to try and satisfy certain needs that people might have insofar as food, and just meet their basic needs. And so if it might be a clinical thing where they're in recovery, but a lot of our clients might also need basic needs that they need filled, such as food.
Right.
And so we try and attack the issue from all angles, not just from a recovery and clinical standpoint.
Right, because when you talk about the isolation, I mean, that is one of the triggers, if you will, but then so would not being able to put food on the table.
Yeah, exactly. People in recovery, or people in general, have a survival instinct that they might tap into, if they can't get their basic needs met.
Val, so we hear about the struggle, right? But tell us about some of the success stories that you're seeing during this pandemic.
Well, we do know that there are international 12-step meetings, ongoing 24 hours a day. And there are folks from all over the world that are on those, on this one particular fellowship 12-step meetings. Last I was on it was over 600 plus people. They can call the Lighthouse and we will give them the login number for the Zoom. But we do know that recovery is very possible, even during a pandemic. And I was talking to Miss Athena last week, and I was looking up the definition for pandemic, and I was thinking, you know what? For us treatment providers, we've been in a sort of a pandemic ourselves, because we've been dealing with this disease of addiction, and we know it's a brain disease. It's not that they're bad people or that it's a moral failing. It's there's a certain region in the brain that when you wake that up, it's a primal instinct. And a person who finds themselves struggling with drugs would rather use drugs than to even eat. And so we teach that in our treatment centers. And we know that people who do experience some form of recovery, if they stay long enough, they will feel and see the benefits of it. And I always remind clients that if you've been using drugs for 18, 20 plus years, entering a 6-month treatment is not going to fix all the problems. It takes time. And I was listening in on Jesse's presentation a little bit earlier, and he said something is very, I think it's critical to understand, is while in treatment, we lay the seeds down and they leave, and it's their responsibility to water that and then to see it grow. And whatever you put in is what the fruit is, what's going to come out. So if you gave enough time and enough effort into your form or your definition of recovery, you will see some form of benefit. Simple things like having an ID, going to your job, and then you get to stress out on simple things, or I won't say normal, but things that we didn't stress out about before, like I got to go do my laundry, I have to pay my power. Those are the privileges of recovery, right? Because while we were actively using, we got our power disconnected every other month, and so we're tired because we have to go to work. I mean, what a beautiful thing to have a problem with, So I think that there's a lot of folks out in our community who are in recovery and who are able to sustain their recovery even through a pandemic, because we've all lived through hell, and we've survived so much more than what we're going through now. I think that if you can survive 18 to 20 years of using, you're a soldier already. You just were in the wrong part. Yeah. So I think it's very possible that people can live in recovery and become productive members of our community and pay things like taxes and stress out about lining up at the bank to cash their check. I mean, what a beautiful thing.
Or paid or built.
Right.
Not so beautiful, but
Well, all I can say really is we just really appreciate everything, the Guam Behavioral Health and Wellness Center is doing, the Lighthouse Recovery Center. But at the same time, it's got to be frustrating on your end when you don't see, because there's less than a handful, I think, of places people can go to get treatment. And it's got to be frustrating when you don't hear from our elected leaders about I guess, providing more resources to fight this battle? Because sometimes I feel like you guys are out there on your own fighting this battle.
It does. It feels like that. And I can tell you this, it's just an idea. But if we could get even just 1% of the taxes from alcohol sales, we can increase bed space on Guam. Just 1%. It's not much. But I can tell you that if we can secure more resources as far as funding, the Lighthouse can and will hire other counselors. We will increase bed space. We have the capacity to do that, and we can double up. I refuse to believe that there's only 15 people on Guam that need treatment. And I know that Oasis is doing the best job they can, and their bed space is limited as well. So if you look at our population and the number of people getting arrested in the front newspaper, and we are now seeing that there's a spike in females getting in trouble with drugs, we know that it doesn't match. The numbers don't match. We need more beds. Yeah. We need more money to fill beds.
Right. Athena?
That's in the works. Our director is already, Teresa Ariola, has already expressed to me that we have some funding available that's coming our way. We also have grants that we have that are available. It's a constant working on making sure we have those resources, and it looks like the government is the government already said that substance use treatment is one of her main platforms, and she's really pushing to get a lot of resources to come our way. And I have spoken with our director, and she's made it clear that she wants to increase bed spaces. She wants to look at more real estate in terms of helping house deal with their programs, because that's what we need. We need the programs to expand. Well, and it's in the works, slowly but surely it's getting there, and it's pretty exciting for us. It's been a long time coming for the expansion, and it looks like it's really going to happen. So we're working on that. But you talked about success stories also earlier, and really our theme for this year's for Recovery Month is celebrating connections. Is that a lot of our consumers, if anything, always told them, since I started at the Guam Behavioral Health 20 years ago, we always reminded them stay connected, and celebrating connection. Really what we have to do is to keep their treatment and their recovery more successful.
Perfect world, you have an unlimited budget. What type of facility does the island of Guam need to just really turn the corner on recovery and addiction?
In a lot of the talks that Valerie had, and we've talked to Oasis, and it really looking at recovery homes is something that we really want to work towards, because we have individuals who go into residential, but when they complete the 6-month program, if they don't have a follow-through, if they don't have secured housing, if they don't have a job to look forward to, then we end up losing these consumers back out into use again. And having recovery homes is something that's different, because then they learn, to live with other people in the home, but also learning to pay bills again, learning to budget, learning a new craft, learning a new trade, something other than, dealing drugs and whatnot. But recovery homes is really something that we're looking into, so that we can help the individual move forward after they've completed initial treatment. Because, they feel successful when they've completed initial treatment, but if they have nothing to follow through on afterwards, like school or new goals or a job, then that makes it a little bit more difficult for them and what they see for their future. Right. So recovery home really like our new
holy grail.
Our new
Mm-hmm.
Yeah.
And I just wanted to give a shout out really to another success story from the Lighthouse Recovery Center to Eric Borja. Right, he's getting married today to Shalina Matsanani. So
See ya, Day. Don't come knocking. Jeremiah, I wanted to kind of maybe direct this question to you, is because being in the media, we report on a lot of these, well, like the bus, right? I mean, and you see so many times the same people just over and over, pulling over, the glass pipe, the straws, robbing, breaking, entering, but it seems to be like, I mean, geez, I don't want to oversimplify it, but it's like the same 20, 30 dudes and women. How do we reach those, like the career offenders who are just so deep in it that they just need that lifeline? Or do we have to wait until they're ready to turn their page?
Yeah, I think you hit it in the head, the nail on the head right there when you said we have to wait until they're ready. And some of the things that can prepare them or have them change that view is maybe another arrest and things of that nature, because sometimes jail does work, and sometimes it doesn't work the first couple of times. So with a lot of the bust that's going on here in Guam, you just don't see a bottom yet, and you reach your bottom when you stop digging. You decide to stop digging, So they definitely have to be ready for recovery, because it's a whole new way of life, really.
Right. Do you ever see those mug shots, those stories in the news, and you ever think? I know you said, and we'll direct this one to Chris or whoever wants to answer it, that they got to make that decision on their own. But I mean, it's got to just hurt your heart to wait for that moment when everything in you is like, let me reach these people, let me help them, let me share what I know, let me share my story, when they're just not ready.
Right.
So Chris, one of the definitions or the diagnostic criteria for substance use disorders, continued use despite negative consequences.
Right.
Now, that's so those arrests, those negative consequences that people experience, that's their normal, and it's very difficult to elicit a change through negative consequences, because that's one of the tenets of a substance use disorder. I think that, and one of the things that we do is we meet the client where they're at. Now, they can be ambivalent or they can be very pre-contemplative, but we're trained in how to increase motivation by showing the clients, like, have them think about what if you did this or what if you did that. It's called motivational interviewing, and that's one of the tools that we employ. The most important thing is that they come through the door, they try and make contact. A lot of our clients that we get here at the LRC are court ordered to enter treatment, but they still have to make it through the door. So, if they can make it through the door, then at least we can work with them.
Right.
Usually, Chris, it's the person who's the person who's using the drugs is usually the last to realize that there is a problem. It usually comes in way of messages through the boss or loved ones, and usually the person who's actively engaging in misuse of substances will be the one to not see the problem until it's the last thing to look at,
Right. Can we talk about a little bit? There's a comment here from Bobby. Hi, Bobby, about support, right? For families who want to support their family members. And let me just give you maybe something, generally speaking, like and it's so tough because I've had the family members where it's just, they're addicted, they're stealing from the family, they're, domestic violence, all that. But, in our culture, it's just so much. At what point does a family involve you guys or, the authorities? Because a lot of times I feel like when we have these addicts in the family, it reaches a point where they're preying on our empathy and our compassion and just our culture to just always, no matter what, take care of the family. And maybe even if that means covering things up so that, we just set it and forget it. and accept that the norm is, oh, you know, Joseph is going to steal the bush cutter. Oh, he stole this again. Oh, okay, you know. So at what point, when you talk about the users and the addicts being the last to know, does the family also have a role in calling you guys and reaching out for help? Because, I mean, I know families and they're just struggling with it and they're in over their heads.
Absolutely. You know what? A lot of families call us. They call us. They want to know what they can. Really, a lot of what we talk to them about is to come to our family education program so they can learn more about addiction. But we also tell them, you know, you have to also focus on yourself because you're spending a lot of time focusing on the individual who's using, and just continue to encourage them. Hey, when you're ready, I know a place you can go. I know who you can call. I give them my name. I give them my number, and I let them know that. I have a peer call them to actually call the individual and say, hey, you know, my name is so-and-so. When you're ready, you know, come into treatment. I know a place you can go. Sometimes we have our peers go out and get people, and we have them, you know, walk them in the doors and help them get through, because really that's the first thing, is that it's just taking that initiative to come in and get the help when you know there's a problem, because family's telling you, hey, something's going on, this is not right, you know, you're hurting all of us. But you know, families can, we have a lot of help for the families. Every organization that we have partnerships with have a family education program. Ours is open to the public, although we haven't had it's only Zoom wise that we can provide services right now, but that's better than none.
Amen.
You know, it's always available. The education program, we want them to understand addiction and really what's going on in their loved one's brain and why they're behaving the way they do. It's not so much an excuse as to why they do what they do, but it's a biological issue that's happening, a concern, and we want them to know normally when they're not using, this is not how they would behave, and they know that. So having them understand that and work with it helps them understand and helps them talk to their loved one and have a better communication with them once they understand addiction a little bit more. But you know, otherwise, families are always give us a call. Our crisis line is 24/7. I know that Togi is also just opened up their warm line, so that's another resource that they can tap on.
Warm line, I like that.
So to go off
Go
what
ahead.
Athena was saying, the importance of the family education program, and I encourage family members to come in and check it out, you know, before the fact, you know, before they discover that someone's addicted in your family, is to understand that addiction is a family disease, and the family model of addiction, everybody has a role, right? To understand what role you played in that disease is very important, right? So that everyone can recover. So what happens is that the person in recovery, you have the person in recovery, and then you have the family recovering with the person. You know, so that's the best way to understand it, is to come and learn about the disease and whatnot, because it is a disease. So we're dealing with, in essence, we're dealing with people that are sick. You know what I mean?
Val, if you could, we're up against the top of the hour, and we got all month, guys. I reached out to Therese and Val, if we could get you guys back on to kind of maybe more specifically look at some of the services that you guys are offering. But I'll just give you the floor, message out there to not just the people in your programs, but maybe those people you want to reach, or their families or their friends.
You don't have to suffer or struggle with this alone. There are treatment centers and treatment providers, and we are here. We're not promising that we're going to make things better, but we are saying we can do the best job we can to work with you and your family. I can say that.
Numbers? Who do we? Where are the numbers? So we're telling families to call. Maybe give us the numbers, a website, Facebook page, ways to get a hold of you guys.
For the Lighthouse Recovery Center, the phone number is 477-7671. And my cell number is 727-8533. And you can text or call. Some folks are not comfortable calling, so they feel more comfortable texting, and that's completely fine. We don't close. We're open 24 hours, 7 days a week. So if you are in a need of to just get a hold of a person, just call the Lighthouse and the message will be passed on. 477-7671.
Athena?
Yes. Okay, so Guam Behavioral, of course, our crisis number is 647-88. Give us a call line, and what they'll do is they give me heads up on who's called with the number, and we return the call as soon as possible. So that's normally what we do. I'm also right now searching for hold on.
Yeah, I kind of.
They just got their warm line up and running.
Oh, nice.
I believe they're.
I've got the number.
You have the number?
Yeah.
Oh,
Yeah.
Can you
So
say
it's 998. So the Togi warm line is 989-6687, and that's a 24-hour warm line. So 989-6687.
Right, 989-6687.
Yeah,
Chris,
the Togi.
Jeremiah, Val, thank you guys so much for joining us. Athena, let's go ahead and get you guys on later on in the month, and we just really want to go in on, maybe we'll get Eric on too, when he's on a day he's not getting married. Be safe, and definitely we appreciate your work as frontliners in this recovery pandemic, right? Okay, thank you.
Thanks, guys.
Thank you.
Hasta, Val.
Thank you.
Okay, Chris, Jeremiah. Bye, Athena. All right, 9:02. Good morning on you. It's the Link of the Breeze, 93.9. A lot has been happening behind the scenes here as we just got the word from the Guadalupe press secretary, Crystal Paco, that the governor is inclined. I don't know why I find that funny.
Right, she's likely going to be making an announcement about the stay-at-home order, that it will be extended at the 10 o'clock press conference. And the 10 o'clock press conference, of course, is to talk about the Guam COVID alert app, which actually is already available now.
Okay. Yeah, I think from our view, I mean, we've been hitting the page like crazy. We've been stressing out the service, and it is live now for both iOS, for iPhones. I tried it. It does not work on iPad, so you have to use your iPhone, and for Android. Joseph here, we've got a couple videos that Sabrina and I were kind of like walking through the setup flow. It's very, very easy to use.
Yeah,
and
super easy.
Dr. Felix Rivera was stressing it before, and like as a computer guy, I have to absolutely agree with him. The one thing you have to know about this app only works if everybody uses it. The more people that use this, it's a network effect. We make ourselves stronger, strength in numbers, community, however you want to say it, and everything like that. It's absolutely free, so get it for Android. Get it for iOS, and basically what it is now, I know what you might be saying out there. There's some privacy people that are saying like, oh, is GovGuam going to be spying on me or anything like that? It's not like that at all. It actually anonymizes your phone's digital signal. Basically, it sends a heartbeat over Bluetooth, low energy. So you're not using your Facebook profile. You're not doing anything. You're not going to submit your number, your social security account information, bank statements, anything like that. You're completely anonymized, and it actually generates a token that changes every few days. So, you're not always tracked by the same profile and everything. We got the information up on screen. It's very, very easy to use, so young kids can use it. If young kids have a phone, you can actually have your older people in your family, encourage them to do so. I actually just sent a message to my mom on WhatsApp because she's teaching right now for St. John's, and I was like, hey, it's live right now. Just, put it on your phone, please. Encourage all your students to do so. And again, this is basically going to say, when you do have movement patterns and things like that, if there are known places on the island where infections have occurred, it's going to tell you based on how you've moved and everything like that, if you may or may not be, or if you may be at risk of developing an infection for COVID-19. So, I mean, it's free. It's really, really easy to use. You can see how super easy it was. And, there is zero risk of you giving up any personal information, of, foreign governments spying on you, or getting some sort of information and everything like that. And this really is the thing to do. On InfoZoom last night with Nestor Lecanto, he was interviewing people with the Guam Visitors Bureau, and Dr. Jerry Perez was actually heavily emphasizing that they're really trying to use consumer technology, because we can get it out so much faster, and just say give people some sort of technical means that we can be able to track the spread, know where to avoid, know who's
Right.
walking around. And they said, and ultimately GVB also wants to use this for the traveler industry when that begins to open again.
And so I'm just reading off of the app and how it works. Public health, they never collect or process any personally identifiable information from the Guam COVID Alert app. Bluetooth random IDs are assigned to each device using the Guam COVID Alert. Each user's random code changes frequently to further protect their identity. When a Guam COVID Alert user comes into close contact with another Guam COVID Alert user, their random codes are exchanged using Bluetooth. Random codes for close contacts are stored in a user's device for 14 days. No personally identifiable or location information is collected, stored, or exchanged. Now, if a user tests positive for COVID-19, they may choose to notify other Guam COVID Alert users who may have had close contact with them. Now, to trigger such notification, a user who tests positive for COVID-19 must enter a valid 8-digit PIN provided by a public health contact tracer.
There you go.
The PIN is randomly generated by public health and only used to enter a positive diagnosis in the Guam COVID Alert. Now, once a valid PIN is entered into the app, a risk calculation is made using the time, duration, and Bluetooth signal attenuation or proximity indicator collected by the Guam COVID Alert for each contact event between Guam COVID Alert users and other Guam COVID users who are calculated to have been in close contact with the user who tested positive.
And if I can just add for some context and everything, for those people who may still be on the fence and be like, I really don't know if I want, anybody, knowing where I am, of what I've done. It's not like that. And basically, you do the exact same thing when you've been using Google Maps on your phone or mobile devices all these years. If you ever go into, do it right now. Go into Google Maps and enable the traffic view and how it shows which different traffic lights and which, four-way intersections have, greater traffic density. It's because you're actually giving anonymized location data about yourself to Google, who then generates these things that let us know where the traffic is and everything. And it's very, very free. No one knows exactly who you are, and it's super cool.
Right.
And you're taking care of the island. This is another way that you can help combat COVID.
Yeah. Again, it is voluntary.
Yeah.
But the idea is for people to join so that we can join this fight.
Yeah. The more people that have the app, the stronger it becomes.
Okay.
There you go.
And the press conference, again, is at 10 o'clock. We're going to be carrying that press conference right here on Facebook, which means that we're going to be going out of this show a little bit early so that we can set it up for the press conference.
Right. And that being said, we got to take a little break, play a little catch up. Coming back with Dr. Kenny Bourgeois right here on the link. It's The Breeze, 93.9. Good morning, Guam.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Hafa-day. My name is Margarita Gay. I'm a registered nurse at the Department of Public Health and Social Service. The Centers for Disease Control recommends wearing cloth face covering in public places. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
Half a day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Guam Animals in Need, aka puppies and kitty cats, on your Facebook live stream.
We also got the sad news this morning that we recorded our 21st COVID-related death.
Mm-hmm. And there's a press conference 10 a.m. about the Guam COVID Alert app, but we are tracking that the governor is inclined to announce an extension to the PCOR 1 lockdown. I asked Crystal Pacos-San Augustine, the Adelup press secretary, whether or not there would be an easing of restrictions or additional restrictions, and she said that they don't know yet. She doesn't know yet, and we'll find out. So we're going to cut out a little bit early so our team can prep for that press conference, which we are anticipating is going to start off on the Guam COVID Alert app and then maybe morph into some kind of announcement about this current lockdown, which was supposed to end tomorrow, but it's not. That being said, let's go over to the KUAM News Zoom room where we have, he's a self-described counter voice, which always makes me a little nervous. I had to ask him yesterday in prep talking, like, man, Doc, you're not crazy though, right?
I hope not.
At least not that I know of. I always answer that with, well, what's crazy? So, Doc, let's
We're
just
all a little crazy. Come on now.
Let's start there with this news that we're anticipating an extension to the PCOR 1 lockdown. Dr. Kenny Bourgeois, what are your thoughts on that?
Well, I guess I just want to kind of open in one and appreciate you having me on the show. Yeah. And I just kind of in a little summary of why I feel like I want to express it is because Chris, I've always admired the fact that you've kind of been proactive and willing to probably go out there and say what's on your mind. And I tend to be a proactive person as opposed to a reactive. And as far as the way I feel about the politics on Guam, I don't call myself a Democrat. I don't call myself a Republican. I probably call myself somebody that votes on the issues, on the character of the person. And that's how I look at national, and that's how I look at what's going on Guam. And just for the viewing audience, I've been here since '87. So I like to tease everybody and say I look white on the outside, but I'm brown on the inside. And basically, I guess I've been sort of sitting, working on the sidelines a lot in dialogue with Dr. Shea. And so our positions a lot, go all the way back there. I had shared with you on the pre-talk that the angle that I guess I'm really wanting to take a position on, and hope that the viewers will actually assist me in some way by a contact that I can provide later in maybe the program, of just the ability to find myself trying to be a voice of reason, because my biggest frustration is that I've come from 3 experiences. One experience is 11 years as a Navy dentist. I was in the Navy as an enlisted guy, and then also 5 as a dental officer. And 3 of those were here before I retired. The other one as just a general dentist who was an infection control officer for 3 years here on Guam as well. But I was gone through the evolution of where dentists didn't wear masks and they weren't wearing gloves, to where when the threat of hepatitis and AIDS came on board, that we were dealing with fluid type of, protection. And a third one that I wanted to address is that I come from having also been bivocational and pastored a church for 25 years here on Guam, Island Praise Fellowship, which was formerly Calvary Chapel, but it's not the same one that was in the news. So, I just want to address that my biggest feel of using FOIA and getting letters, I've been tracking conversations between the speaker and the admiral, and I kind of feel like I did a lot of homework last night in looking to see what is the chain of command, because one of the things that I learned in the Navy, and you can interrupt me at any time to ask the question because I've just got a lot on my mind that I want to share, so I don't want to override. But the biggest thing is that about a week and a half ago, I contacted Lieutenant Commander, I think Rick Moore, who acts as the liaison of the public relations for the Admiral. And one of the things that I learned while being in the Navy was when I came in as an enlisted guy, I often felt like you're on the bottom. You saw there was a need for change, but you had no outlet because you were always fearful of the fact that you couldn't get your voice high enough. Then the thing that I learned later in the Navy was that there was a mechanism called point papers. I reviewed the letters that were written by the speaker and by the Senator Forrest Perez, and basically, as far as being able to get up high enough, you have to write what's called a point paper ability to make sure that a point paper in the military is where you can't break the chain of command. And recently, the USS Roosevelt captain, I don't know how he did it, but that's the way he could have kept himself out of hot water, was if he had done it through a particular method. Maybe he did, maybe he didn't, I don't know. But it's when you're writing a memo or a point paper regarding something that you are passionate about, you have to write that you are going to give it to the person that is directly in the chain, but you have to give it also via in the memo, so that on the via part, it lets that person, like in the case of where these letters were written directly to the Admiral, had they been written from my homework that I did last night, had they been written directly to the OIC, which is the Office of Interior Affairs, or the Insulary, and from what I can tell is that the chain of command runs, for the Admiral, it runs directly to the Department of Interior. He plays a role, but he's not going to do anything. And I've got letters where both the speaker and the senator were asking the admiral, and that's kind of my bent, is that I'm not trying to point fingers, but like I told Lieutenant Commander Moore, I said I'm very upset because his eyes, I feel like what we're watching on Guam is a manipulation of the data. And even if you look at the death rate, I was punching the numbers in. You can't punch on the death rate. You can't punch the number based on the number of tests that you have, because otherwise you're going to skew the death rate and scare the people of Guam. And that's one of the things that I see, is that when you look at the death rate, instead of it being like on the latest one that I got, it's close to like 3.38%. And she's added one more, I guess, according to what Sabrina just said. And the problem is that when you don't multiply it by the total number of Guam, and I looked on one of the consensus, it said we have 168,800 or 484,000 as of 2020, give or take. So when you do that, based on the death rate, it's 0.0005%. And that makes a whole lot of difference between a 3.3% death rate. Also, when you're talking about the test, you have to, what's going on Guam is you're not reporting. If you were doing a biologic paper, you know, and when you're getting your degree, if you're doing any kind of paper and you have an hypothesis, you have to prove that hypothesis. You can't just put stuff out. And one of my science teachers, she wanted to develop, she gotten hold of moon rocks, and she wanted the moon rocks to have a certain amount of data. But what she was lecturing us on was that it's so easy to manipulate data in the way that you want it to go.
Doc,
And
I'm sorry,
one of my
Doc, but I'm
strengths-
kind of getting lost. What are you trying to say here?
Yeah, Doc, we're
What
kind
I'm
of going
trying to
all
say
over.
is that when you're looking at the data that is being put out weekly or daily,
Mm-hmm.
for example, the last one was like there's been 34,000 roughly of the tests, right? So of the 34,000 that have been tested, they take and they will divide. Well, it would be 21 now. When you divide that number and then you multiply that by 100, it doesn't come out to 3 point. You can't. Even at the bottom of it, it'll say this is done
He's
based on the
basically saying that
molecular testing.
you're basically saying that we need
And the
to.
molecular testing is basically the basic test that everybody's getting.
Mm-hmm.
And we have to have in the data, we have to have that we are not only are we testing, but we need to know more than just that little screen that says that. We need to know what's going on in terms of symptoms. And somebody can have a positive test, have the antibodies, or have a positive test and be completely asymptomatic. So if you're trying to skew the population to lock us into PCOR, and you're trying to skew the population to make us look as though we're worse off than we are so that you can stay in this state, then you're playing with the data, and you're basically creating a false narrative. And my disappointment has been that the admiral is sitting on the sidelines, and having been in the military, what I bent the ear on with Lieutenant Colonel Moore was I said, Commander Moore was I said, the mission is being compromised because every one of our bases, our hospitals, every time an EMS chooses to pick up a heart attack victim and go to the hospital, we are putting basically at risk our community. For example, right next door to me is a person in a military family that lives off the USS Cable. And the Cable was just in the news. They're being told, according to the paper article, they're being told to not really let it out, not really talk about it.
Yeah.
And I think that's what I'm trying to bring to the table is that as a military guy, I understand how they want to suppress, because the mission will be compromised. That's where I'm most upset, and that's what I talked to Chris about.
Yeah.
I'm most upset with the Admiral not creating an environment or a forum to where the public, the Chamber of Commerce, the medical professions, the businessmen could have met when the Secretary of Defense was here. And the Admiral, they should not have just had a private meeting with the governor or with just the surgeon. They should have had the ability to open the forum up and let us talk.
Right.
Because I'm very proactive, and I believe teams are built by listening to content that isn't always necessarily what you want to hear. But I always used to tell my team, and I still tell anybody I'm working with a team, that it's always good to have another objective on the other side of the table, because you could say, let's go forward if it's a tree there, and they say, Doc, don't go forward because there's a snake on the other side. So I'm a real big team player, and I don't understand on Guam why we're so closed off to want to hear the medical profession and the community, and to be able to really look that there's bad science being manipulated on sending out fear to the Guam people. A 0.005% mortality rate is not something, and then the positivity rate has to be measured up against serology. You cannot just have the maybe your viewing audience knows it, doesn't know it, maybe you guys know it, but the test that they're doing is a molecular test or an antigen test. And basically that test is basically testing the DNA.
Right. Yep.
Of
We're
the virus.
familiar.
They're
We're
looking
very
for the
familiar with
virus.
the test. Doc, I want to go back to what we had talked about with DOD. And you were telling me that you feel like the Department of Defense, the Admiral, the military, they have the resources. And you were saying you're disappointed that we're not seeing those resources being applied to help some brothers and sisters out outside of the fence line. And we talked about the data of the number of tests that are being conducted in the states. You had said DOD needs to step up. Yeah, so that's what I kind of brought you on for.
Okay, great.
Yeah.
I can see. I've got an article here that says this is right out of the Admiral's mouth. This was from an article from the Post. It was on the 28th of August, and he said, "As to the military, we'll be called in support, but I cannot make the decision alone." And what I'm most upset is that when you look at another report, which comes right out of the New York Times, I don't know if you can see this, I'll just hold it up, get it here. And basically it says, how's your state doing on testing? And on this page, I just pull this up. And on this, it breaks it down. I'd be willing to provide copies of this. But it breaks down every state. And in the opening line of the paper, it says there's an average of 727,000 tests per day that are being performed over the past week, and that their goal is to do 1.4 million daily tests. So when you just pick a state, you can pick any name. If you ask me, just randomly for the sake of the audience, just pick a state right now. Jason asked me about Texas. Texas is got 158,000 per day. And my point is that when DOD and the way our government of Guam is set up with being an unincorporated territory, the Admiral's role and the Department of Defense role, and when I was looking at the OIC, it looks like the OIC thinks that they poured a lot of money. President Trump opened up 42 agencies, and all this that I'm saying can be downloaded, but for the sake of us talking, Chris, the lowest average for testing that I found in this little, all the states, DC, everybody, the lowest I found was 74,000 in Wyoming. So if Guam received from the OIC mass amounts, and there's I looked on to the emergency act that's being put out, that the president, whether you're for him or against him, when you read these articles that are on the Department of Interior.gov, you will find article after article of people who are really thinking that they did a good job. But what's happening is it seems like, just like what I was trying to say early on in the military, if it stops at the lowest level because of ego or because they don't want to approve it and they say no before they say yes, the only way you can get anybody to listen to you is you have to write the letter via so that it goes above the chain of command. And these letters that I'm looking at and have here, they just wrote to the Admiral. And the Admiral's playing politics. He's yielding to what the governor is asking him. And so when they met, what was their solution? Their solution was close down the beaches at the military. That's not a solution. The solution should be, and Dr. Shea and I had written a letter back in April of 26, and we got nothing back. And basically in his letter, Dr. Shea said, I was impressed to see the Navy test nearly 5,000 sailors within 2 weeks. When you read all these letters, all you hear is the Admiral kind of saying, you're sort of on your own, we're working with you, but we can't help you. And both of the senators asked for help, and he basically said, it's out of my hands. And then later, just recently, the article I read in August, he said the same thing in the Post. It's out of my hands. It appears he leans into FEMA. And if FEMA is where the stopgap's at, then we're not going high enough because the OIC is believing they've given us plenty of money and plenty of support. And my position is that the Admiral's sitting on the sidelines as a spectator knowing that we're not getting tested. And if you don't test serologically along with the testing of the positive of the just looking for the virus, and you don't record what are the symptoms, and you don't record whether these people were symptomatic or not, then you get a false narrative. As a matter of fact, one of the data that I looked at, does anybody happen to know what the death rate is on Guam on a yearly basis without COVID? Does anybody know?
I think it's in my other shorts.
Huh? It's six deaths per 1,000. So that's 168,000 people that die on Guam unrelated to COVID before COVID even came along. So we got, and then you have to look at what's on Guam. What's the average age of Guam? The average age of Guam is like 29 years old, 30 years old. So if we got 29-year-olds as the average age and 30 as the average age, what the heck are we doing? Because that's not the group that's gonna infect us. And then you look at the population of COVID to the statistics coming right out of Guam. You'll see that the elderly population is very low in terms of infection. And do you know this? 424 of them were tested positive, which is about 25% of Guam is coming out of the military. So we're skewing our data. Y'all ask questions.
Yeah,
I got a lot on my head.
Right, Doc. Well, we don't have a lot of time this morning as we got to jump into this press conference with the governor's office where we're anticipating the extension of the PCOR 1 lockdown. The takeaways, DOD, military, quit sitting around, waiting for somebody to ask, step up, come out and test the Guam public. Thank you, Doc.
And, huh?
Thank you, Doc.
Oh, you didn't want to address down at the church?
Oh, yeah, I guess we could just real quick talk about that. So what was your take on were you in the service at the church?
Yeah, I did that for two reasons. I did because of the what I don't agree with as far as the civil liberties being taken, and I was there specifically that day. I was assisting with running sound. It's not my church, but I was there. And basically, I'm in total disagreement of that report. First of all, it was very calm. There are about 30 people. I have copies of everything that they did. They were doing everything. And what I wanted to say about that is proactively, what the governor needs to be doing is getting the ministers, who are some of the most compliant individuals on the island, and needs to be creating a council that basically will work. She needs to rescind that $5,000 be proactive. This is a minister. It's not a bully pulpit. And so my position is that they went in there and they were doing social distancing. The families were sitting together, and when the families were sitting together, it was no different than when you get in a restaurant. And these are all CDC guidelines that you can do these things. And I just recommend to the churches to sit down or to create a council in which basically the churches do the same thing that is the protocol to go into a medical clinic. And a lot of them, they already were there. They had the sanitation station. They had posted photos. They had 6 feet apart. And when you had the people that they reported as not having masks, those were people that had already sat down, were with their families,
Same
and
household.
the aisles were set up, plenty of distance. So that's a false narrative, what was put out. And they went in there with a position. They wanted to be a bully pulpit. They wanted to find them. It was not a supportive, let's see really and objectively try and dialogue.
Right.
I can speak for Pastor Joe. He really has a heart not to be a rebel, and he did everything he could to try to be compliant, but he also has like the same position I have. We feel like our First Amendment's being violated.
Definitely a valid issue,
why we were there.
Doc. And, I did put out asked Pastor Joe to come on, and you're right. He didn't want to make noise about it. But we got to run, Doc. I got your number. We'll catch up offline and maybe bring you on again really soon. Some pretty interesting points that you raised, and we definitely appreciate your time here on The Link. It's The Breeze 93.9. We take a real quick break, and we'll come back and close the show with Cyrus Lur. We do also have some breaking news from the world of mixed martial arts. I'll start with the good news. First of all, the good news is Guam's heavyweight champ, Rocky Martinez, has finally got the call to fight in the Ultimate Fighting Championships, as we're now seeing a graphic going around. And I'm going to send you Crank's... he's going to jump on. Okay, Jay? So, okay. I'm going to send you the link. Well, we're going to get Frank the Crank on in just a couple minutes. But Rocky Martinez fighting in the UFC. He will be facing, I want to say Russian. I mean, I don't know, Alexander Romanov, the Black Widow's brother, in a heavyweight bout in the UFC.
Nice.
That's another real humble guy,
Yeah.
really nice guy. He's big and burly and everything, but just like teddy bear, so sweet.
Yeah, let's just get Cyrus on now.
Yeah,
Cyrus,
okay.
thanks for joining us from Guam Animals in Need. Met with a lot of things happening. What is that they say, Cyrus? Rapidly evolving. So we wanted to come on and talk about your Peace Corps ops. I know that you guys are doing this great foster pet program to kind of clear out the shelters. And we're going to throw up the pictures. You guys, as promised all morning long, cue the puppies and kittens. You don't even have to talk, Cyrus. We just got the pictures. Yeah.
Don't you
Thanks
want
for
one of
having
these?
me. We do have. We just want to let people know that we have adoptable animals. It's a great time if you're stuck at home to be able to take in an animal. You can do it short term, or you can do it permanently. If you'd like to adopt, we have lots of animals that you can check them out at guamanimals.org and see what animals we have. And if you're able to just take in an animal for a couple of weeks, we are always looking for foster pets. So, foster families to take in pets for just a couple of weeks. So you can contact us on any of the social media channels out there. Just search for Guam Animals in Need, or you can go to guamanimals.org and click on the foster tab, and our foster coordinator will be in touch with you. And you can take in an animal like Noodles, who's a 2-year-old female, or Carl and Cody, if their photos are coming up. They're 2 male cats. You can take in pets like them and just give them a nice home for a couple of weeks.
What about Minty?
Minty's a sweetheart, and that's a 9-month-old male, and a very small, cute dog with big ears and a very curious
The
personality.
better to hear you with, my darling.
It looks like a chihuahua.
Is that like a chihuahua?
I don't know. When the animals come to us, we don't really have the papers, so we just kind of have to make a best guess. But
You don't want to assume, right? You don't want to be like, hey, what kind of name is Minty? Is that a chihuahua name? Inside joke.
Yeah, well, we're trying to get the word out. So if anybody out there knows of people who would like to take in a pet for just a couple of weeks, please get in touch with Guam Animals in Need, and we can always set you up. It's a largely remote process. We can move the animals and fully comply with DPHSS requirements, and we're always looking for good homes. And I also want to just thank KUAM. On the August 29th, we had our Clear the Shelters event, but we did it completely virtually. We're able to have 14 adoptions in one day, and that was largely a huge help.
Is that a record?
Yeah,
Wow.
it's definitely. I think it's second in terms of record, but that's because we've always had it on site. So we had people coming in. It's a lot easier when you do that. But to do it virtually and to still have 14 done in a day, that's
So it's an asterisk record. I gotcha.
We
got a record, guys. We got a record. Cyrus,
thank you.
Man, when you came on last time, or maybe it was the time before, you're really talking about getting paid from the government of Guam, right? Has that been resolved? Or are we still trying to get...
It got resolved. So thank the governor's office, thank Senator Rigel for introducing an amendment during the budget process. It was adopted unanimously, and so we should be seeing that payment very shortly.
Right on. And so in the meantime, get out there and go foster a pet.
Please do, yes.
Yeah.
Apply online, right?
Yeah, it's a very quick process. Just get in touch with us either on social media or on our website, and we can walk you through the process. It's very quick. It's a short questionnaire that we have. And what a foster does is basically you take in an animal and you just provide them a loving home. You provide them some food during that time. We take care of all the shots. We take care of everything while they're in foster care. And all we need you to do is just provide them a good home and, send us some pictures of them having fun while they're in your home. And it helps us get the word out about people, animals like Minty.
Right.
And we can help find them a permanent home.
Thank you, Cyrus. Send more pics, okay?
We will.
Okay, see you. Cyrus
care.
Lure.
Stay safe.
Guam Animals in Need. 9:43. We just keep...
Yes,
Let's
keep
just
in the Zoom room.
because I know we're bringing on now the UFC fighter Frank the Crank Camacho. We do have a breaking news announcement regarding Frank's UFC fight. Good morning, Frank.
Hey, good morning, guys. It's what time is it over there?
9:43.
Yeah.
9:43. Okay.
AM.
Yeah, man. Good morning. Yeah. I mean, just got news this morning. It's probably the afternoon right now. It's probably like almost like 5 o'clock, 6 o'clock, but 4 o'clock. I don't even know. But yeah, we got news. Bad news, man.
You want me to reveal or you want to?
Just Jack and Poe. Let's
go, Crank.
Yeah, no.
Guys,
no, man.
Go
So this morning upon arrival to the UFC hotel here in Vegas, it's a protocol that you get tested immediately, and then you have to quarantine in your hotel room for a day. I got a call this morning that I tested positive for COVID. We were like, oh, okay. So we wanted to do a second test, and the UFC had us come down again, and we did a second test, and I tested positive again. They rushed it to the lab within hours. I got the results. So officially I'm pulled from the card, and it's such a bummer, the virus really just doesn't discriminate,
Mm-hmm.
How are you feeling though, Frank?
Man, Chris, this virus, man, it's a bitch. Sorry, I just had to.
Let's bring it back, guys.
I'm so sorry. I just
Remix. No, hey, if the governor can say it, you can say it.
No, but okay. Like in all seriousness, though, aside, I'm so glad that, driving in, I had like a little sore throat and just like a little runny nose, and at first I was just thinking like, yo, man, is it the California fires? Because I was driving in from California. Right. Usually it's always the dry air in Vegas because of the desert, but man, knock on wood, thank goodness that, that I'm healthy and no real severe symptoms. Maybe it's just the beginning of it. I'll definitely keep you guys posted, but I'm going to be making sure that I'm going to be taking all the proper precautions, getting as much sunlight as I can, through the window, a lot of hydration, vitamin C, vitamin D, and all the you know, multivitamins and just hydrating and resting up, because the uncertainty, you know what I mean? Like, it's so nerve-wracking, especially being away from home. I don't even know. I don't know what to expect, you know what I mean, with COVID. You know, survival rates, you know, apparently are really good, but man, till the day that you get it, it's kind of like, whew, it just got real, you know?
Yeah.
It just got real.
Well, we're praying for you,
Yeah, we are.
Frank and Sarah and the boys.
You talked to the wife, Frank? What the wife and the boys have to say?
Yeah, so I mean, I mentioned it to Sarah. You know, it's such a bummer that I'm away from home, you know, and now my trip is going to be prolonged even longer. So the UFC gave me the option of either the UFC is going to get me a hotel here in Vegas for 10 days, and then, you know, I'll get tested, and if I'm negative, then I'll be released from quarantine, right?
Mm-hmm.
Or they're going to get me a car so I could drive back home, and I'm going to be, so I actually opted out to go back to Irvine. So I'm going to be driving back to Irvine in probably like 30 minutes, and stay at the house that I'm staying at. I have a room, so I'm just going to be isolated in the room there. And then after 10 days, I'm going to get to, you know, periodically tested, and then from there, depending, you know, how it is, you know, the uncertainty, we just don't know what's going to pan out. But if all goes well, perfect world, the UFC will have me booked for another fight ASAP.
Right.
And so when you said you arrived to Vegas this morning, and then you got tested.
I arrived yesterday. Yesterday.
And so you drove from Cali to Vegas. Were there other people?
Correct. Yeah.
Were there other people in the car with you, or did they all have to get tested too? And
So you know, this is such a weird thing, is because the guy that I drove with, you know, we're training Alex Perez, UFC flyweight. He was in my whole training camp. All my training partners, all my coaches, they all tested negative.
Wow. Real
funky, real weird, yeah. And you know, so I'm like thinking, so here's the list of my testing, right? Prior to leaving Guam, so I got offered the fight, and I didn't want to leave Guam till I got tested, right? Just precautionary. I don't want to be that guy on the airplane, you know what I mean?
Mm-hmm.
Got tested, came back negative. I flew out to the States. A week ago, before coming to fight week, they sent out a home test kit. So I had to get on Zoom with the doctor, and I had to do the whole thing with my nose myself. Brutal. That was negative. And then, so I was approved to come to fight week. Then I came to fight week, which was yesterday, and was positive. Took another test this morning and came back positive again. So yeah, that's where we're at, and it's such a bummer. I'm just so glad that the UFC is very accommodating, and you know, honestly though, like I'm here I am because I'm not feeling sick or not whatever, and I'm so bummed about my, you know, not being able to do my job. But I think right now I'm really focusing on the health and wellness. You know, I really, it's kind of scary just not knowing what to expect.
Yeah.
Like that's the reality of it.
Right.
You know, like
it's a completely different fight for you right now.
Different, 100%, Sabrina. Like, I had a fight against a guy that's willing to take my head off, literally, you know, on Saturday. But now I have a fight that could potentially, you know, like take my life. So, you know, just another fight that I gotta address, and I gotta like any other fight that I prepare for. I just gotta do my best to prepare and combat it. And the best I can do is try to stay as healthy as possible, get the most amount of rest, hydrate, and take my vitamins, and most importantly, I think just stay positive and stay strong.
Right. Yeah, we're definitely going to be praying for you. I mean, yeah, you're the most positive guy.
Mm-hmm.
I mean, and it's tough. I know you're looking forward to this fight. I follow you. I know you. The training camp, it was awesome, right? Training camp was awesome.
Yeah, man. Training camp was good. You know, like, man, weight was good. Man, weight cut is good. Man, everything was going perfect for this guy. It was almost like it was too good. You know, apparently it was. But yeah, hey, you know, we get thrown curveballs all the time, right? You know, there's so much other people that are suffering way more than I am. and when it comes to especially to COVID. So I'm just really blessed to have a really solid, awesome community back home, and an awesome family. You know what I mean? That's constantly sending support and sending awesome messages, and it's just it's really just gonna help me up here, because I feel like this is the hardest battle a lot of times. Staying positive and staying optimistic about situations like this.
Yeah.
Especially when things start hitting the fan.
Frank, so what up? Were you going to kick this guy's ass or what?
Dude, that was the plan, Chris. Dude, so camp was going so good. It was the last fight of my contract. You know how we're talking, I didn't even I really was focusing on this one, and hey, but this is the fight game, and I feel like if anything, this is what martial arts has taught me to do, is you have to adapt to all situations, and it's not only inside the cage. So I'm blessed and I'm lucky, and sorry if I'm a little congested, but yeah, man, it's we're doing good, we're doing healthy, and I would appreciate it also too if everyone was just tune in and check me out online, and I'll definitely be updating everyone. I could tune in, I could jump in with you guys on Zoom again to give you guys an update on how this whole COVID thing is rocking, so I just urge everyone that, man, this thing doesn't, this COVID thing doesn't discriminate. It says, we say that all the time, right? We say that all the time. It's so easy to throw that around, and so easy to go around and talk about all these conspiracy theories or whatever, but it really has an effect, financially has an effect, socially, emotionally, health, physically, so I hope everyone still takes this thing seriously, and like how Chris always ends the interview, man, wash your hands and wear your mask.
Yeah. It's really bittersweet because we heard about your situation, but just prior to hearing about your situation, we heard about Roki, and we were like, hey, Roki's going to go.
So
and then
I'm so bummed because I heard about Roki too, and he's probably here at the hotel right now, or he's probably flying in, or he's probably here. So I'm not going to be able to see him. You know what I mean? So it's we were so excited. We were messaging each other like, yo, Frank, man, we're gonna be on the same car. And I was like, yeah, dude. Because there's one thing that's so different about these fights now, is that you're so isolated versus prior UFC events. Man, you got the fans, you got the crowd, you got the media. So now I was so happy that I was gonna be with Roki, and I could see Roki. We can have a team dinner after after weigh-ins, all this and that, and but yeah, there's a reason for everything, right? And there's a plan for everything. And man, Roki's gonna do his thing. Roki is gonna when I heard Roki was gonna be on the same fight card, I was like, dang it, man, he's gonna take the fight of the night bonus, dude.
Speaking of fight of the night, go ahead.
Yeah, I was like, dang, Roke, why do you have to join? Why do you have to jump into my fight card, man? Stay away, dude. I need the bonus, man. So he's gonna do really well. If there's, I know firsthand that Roki's one of the hardest workers that I've ever trained with. He is way more than deserved, and it's if anything, it's a very well earned opportunity for him.
Definitely,
he paid it in full, and he's gonna be paying, and he's gonna be reaping the rewards.
And speaking of working hard, Trevor, you guys are just doing Trevin. Sorry, Trevin.
Yeah.
Can't believe I said that.
Yes, so I was just messaging Trev too. I was like, man, wow, Rita started out for the local boys, So Trev got the W. I was planning to get the W. Roki's gonna get the W. So unfortunately, mine's gonna be slightly postponed. But
no, you're still gonna get the W.
Yeah,
it's a different fight.
You're gonna knock out COVID,
right?
buddy.
Yeah. Oh, for sure. I'm gonna get 2 Ws.
Yeah, there you go.
I'm gonna beat COVID, and then we're gonna get this next UFC win.
Nice, Frank. Our thoughts and prayers with you, Sarah, and the boys. Be safe, man, and keep us posted. And just remember, like you said, this thing's a bitch. Hydrate, take your vitamins, wash your hands. I know you can't stay home, but wear your mask and all that stuff. And Jason was just saying, a little bit ironic. Your shirt. We see your shirt there. It says virus.
Oh, it says virus. I know. I had to wear it just for this.
There you go. Thanks, Frank.
But man. But then again, to add to your finishing remarks, Chris. Sorry, I didn't mean to interrupt you. But I aside from all the stuff with the vitamins and the rest, man, so we all got to stay positive here and stay strong in here, and give as much support as we can to each other. So. And I appreciate you because you guys are giving me the support right now, and I love you guys for that. Thank you.
All day. Thank you, Frank.
Take care.
God bless.
Be safe.
You too.
Be well, bro.
Later.
That's that.
Bye. We'll check in with you later.
We're gonna email you load to go. Okay, bye. 9:57. Hey, the mayor of Essen took it.
Yeah.
So the takeaways this morning, Bree, because we got to get out for the press conference. We broke the
21 COVID fatalities to date here on Guam. There's a press conference. We got to get out. The press conference is about to start in a couple of minutes.
Right. Yeah, because they always start on time.
Yeah. Dr. Kenny Bourgeois, I am not
I don't
sure
know
what he was saying. But Rocky Martinez, he's going to be...
sorry,
he's on the fight card for this weekend. Cheer him on.
Right on.
And also cheer on our boy, Frank the Crank Camacho. The sad news that he tested positive for COVID. And he's going to be fighting that battle as we speak.
Yeah.
But he's positive.
Amen.
And we know he's going to kick COVID in the ass. So.
Yeah, and I mean, Frank, if there's any guy out there who's going to turn testing positive for COVID-19 into a positive mindset, it's Frank. I mean, some people get handed a major curveball like that. They're not going to be doing a Zoom. They're going to be in the, just down, man. So thank you. And he's got a lot of fans. I really feel like he's a guy who bridges the islands from, Tinian, Saipan, Guam, Luta, all that stuff. So, yeah, definitely rooting for him and really rooting for Roki. Roki is a hard worker, man. This guy. And
you ever trained with Roki?
Have I ever trained with Roki?
Wait, did we do this in the mix with him? Oh, my goodness gracious.
I don't want to train with her.
Taking it easy on me.
Yeah, no, this is a guy that he works hard, and I love it when he faces off against these big dudes, and they just have no idea what's coming.
Yeah, we're gonna try and get him on. What's today? Thursday?
Yeah.
Yeah. Hopefully we can get him on.
Yeah, maybe we'll try and get him on
But
tomorrow.
yeah, I think he just landed. In Vegas.
Okay, it's 9:58 again. This is the link on the Breeze 93.9. Thank you guys so much for your support and watching on our Facebook live feed. Again, we're cutting out, but keep it on our KUAM News Facebook page as we're going to be streaming live at the press conference.
The governor might be making an announcement about the extension of the stay-at-home order, so stay tuned, stay locked right here.
All right.
To where are we on? 93.9 The Breeze and our Facebook stream.
Thank you. Good job today, Sabrina.
Good job, Chris.
Joe Sir, Jason Solis, Kengineer, Master Control. And remember, we got your 6 with the KUAM News team in our primetime show. Hey, thanks so much for watching. My name is Chris. We'll leave you with a little bit of 3 times study. What'd you say?
I said, I'm Bree.
Yeah. Oh, hey, what's up? When'd you get here? All right. Hey, we'll leave you guys a little 3 times steady.
Bye.
Be safe. Wash your hands. Okay? My name is Chris. Hasta. Adios.